Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra.
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Good morning, everyone. Happy Tuesday. How's everybody doing? Just getting our links all sorted out, waiting on Blake and Aaron to jump on the live stream here. And then we're going to be ready to rock and roll. Hope you guys had a good night. Talking about a very, very important topic this morning. One I feel like, especially this morning, I really need. I gotta figure out a better way of getting some good sleep at night because it is just not happening, good folks. Let me just link in our Instagram folks. I know they're on standby waiting. The process of adding them is a little bit different, so we have to add them after we go live and everything else. But it just takes a little second here. So we're going to get them sorted out and add them in. And I see Blake and Aaron. Looks like they're ready. And by the way, the governor is coming on today. Spread the word. Okay. Yeah. Spread the word. The governor is going to be here.
All right. Stand by. We're going to go live.
All right. Mm-hmm. All right. Yes.
Big news. I have some important news for you.
Interesting news.
It's Blake and Aaron's Spilling the Tea with Sandy.
Cayman's top news headlines of the day from CMR.
Good morning, Sandy. How are you?
Hey, good morning, Blake and Aaron. How are you guys doing this beautiful Tuesday morning?
Great. How are you?
All right.
Oh, we're good. Good. All right. So we got a couple news headlines this morning. The police confirmed that a man has been arrested in the Mostyn's gas station robbery, which happened on Sunday night.
Okay.
21-year-old man from Boddentown was arrested on Saturday after he reportedly robbed the gas station there in Boddentown of cash and other items. No bueno. But shortly after 8 p.m., he decided that he would try his luck. And the authorities responded to a report of a robbery. The man was wearing a black hoodie, entered the store behaving in a threatening manner, stole cash and other items, and he left the location in the direction of the beach. Well, officers arrived and decided that they would have a walkabout. And sure enough, they located him and subsequently arrested him on suspicion of robbery and possession of an imitation firearm with intent to commit a crime. They also recovered stolen items from the store. Good job, RCIPS. Hopefully this one's an open and closed case. Yes.
Until it goes to trial.
Behave yourself, Blake. All right, Stew Turtle and Swanky are officially named the national dish and drink. So the government I can't believe that we never had an official national dish before. But anyway, the Ministry of Youth, Sports and Heritage has announced that Cabinet has selected 5 new national symbols for the Cayman Islands, recognizing the importance of national identity, including the national dish, which is stew turtle. Interesting, given how controversial it is, but nonetheless, I think most Caymanians understand it. National drink is swanky. national dance, the Cayman quadrille, and the national dessert, Caymanian heavy cake, which is that's a variety because that can be anything from like cassava, yam, that can be a number of different cakes. So it's interesting.
I thought breakdancing was the national dance.
Breakdancing?
Yeah, not the quadrille. Like.
And the national dress.
Thought it was synchronized swimming.
Ooh, Lord, no. Then they have the national dress for both men and women. Interesting. And so these new additions will join the existing list of national symbols, which include the Cayman parrot, the silver thatch palm, and the wild banana orchid as official national symbols of the Cayman Islands. Surprised we never had them. My goodness. That says a lot about culture. But anyhow, that's for a longer discussion.
Yeah.
A new report says that Cayman Airways is operating at a deficit despite major contributions to the economy. So this is the Auditor General's report. That it contributes over $200 million to the Cayman economy. It still has been operating at a deficit. It says how the national carrier is funded remains unclear. No bueno. Anyway, you guys can read the report, The Efficiency and Effectiveness of Cayman Airways, issued by the Auditor General's office on March the 11th. We're gonna dig into that one at some point because I think that needs a deep dive.
That was yesterday.
All right. Two final things. 9 people have died after eating sea turtle in Zanzibar.
I was going to say when you said this turtle, I was like, I'm pretty sure I just read a story about that. But.
Yeah, clearly they need some cooking lessons from Caymanians. That's all that is.
I think they were also saying like that because of what the turtlefish, like some jellyfish that the turtlefish jellyfish that the turtle ate. Maybe.
Oh, really?
I don't know.
Yeah,
they're eating the stomach?
Yeah, there's some bacteria. It happens off and on because a couple of years ago we reported on it as well. But there is some kind of toxin that I cannot pronounce that they find sometimes in sea turtle meat, and so it's contaminated with this. It's called calinoxetins or something.
So marinated turtle, not a good thing.
No, you want to probably make sure that you cook it extremely well.
It's not my thing.
Yeah. So it can. This toxin, it can be deadly. So
turtle sashimi, not a thing.
No.
No.
Definitely not. All right. Congratulations to UCCI. Their team has defeated regional universities in research challenge. So they say they've reinforced the institution's position as a leader in finance education within the region after it was recently victorious in the prestigious CFA Institute Research Challenge Atlantic Islands region. So the Chartered Financial Analysts Institute is a global association of investment professionals, and they have this event. And they said this notable achievement marks UCCI's 4th consecutive win, underscoring its commitment to excellence in finance research. So good for them.
All right.
Yeah, congratulations to everybody who participated. UCCI has been doing a lot lately, I must tell you. They've been busy.
Yeah.
Okay.
Yeah, good stuff. All right. Can I throw in one final one about Haiti? Because we were talking about Haiti quite a bit yesterday. We'll pick up on this during the show.
I don't feel like this is going to be the warm and fuzzy.
I was like, this is not the warm and fuzzy.
Well, it depends on who you ask. Their prime minister has resigned.
Yeah.
Right? He finally caved to pressure, both international pressure and obviously within his own country. He's not in the country at the moment, but there are countries that didn't even want to take him. And they had a huge meeting yesterday across the Caribbean, and top diplomats from across the Caribbean and the United States of America met in Jamaica to discuss the crises facing Haiti and the way forward. And I think one thing that was clear is that he had to go. So there you go.
Don't worry. A guy named Barbecue will fix it all.
Oh my God.
Like, are you kidding me? This guy not barbecue because he likes jerk chicken or anything.
His name's Barbecue?
Yes. I think it's barbecue because he likes
barbecue. Former police officer who's now a gang leader.
Yeah. So it's going great over there still.
Yeah. Yeah.
I feel bad for just the people caught in the middle of all that.
Yeah, it's a sad situation. But anyway, maybe that's a silver lining that he's resigned. We'll take it as good news.
How about you plug who's going to be on your show today? That's the
yes, that's a bit of good news.
There you go.
Right.
Accent.
We've got the governor gracing us with her presence at 9:00 this morning. So we're so tickled pink to have her. This is in fact her first appearance on the program. So welcome together.
Wow.
That's
Oh,
great.
yeah. Yay. Where's
you.
my,
You
where's my
made it.
little-
Finally.
Well, you know, the other governor actually was a frequent, he was pretty frequent on the show.
Yeah.
Yeah. And
He knew about all the time, Martin
oh
Roper.
yeah, he gave us a lot of time. I must say his style is, you know, he would give us a lot of time on the show.
Yeah.
He came on and be like, I'm here for as long as you need me.
He was on our show too.
Yeah.
Yeah.
Great guy.
Yeah. All right.
Once.
Have a
He
good
never
day.
come back.
I think he's on twice,
I
right?
was here twice.
Yeah.
I think you guys scared him off.
We have a
Especially
tendency to
Blake.
do that.
I'm
You
sure
never know
it
what
wasn't
to do.
Aaron.
Huh?
Yeah, it was all Blake's fault. All right,
Probably.
guys, have a good one.
Bye-bye.
Bye.
Bye. All right, folks. Good morning. Good morning. Good morning. How's everybody doing? Happy Tuesday. And of course, you guys know what it is. Stephanie says tickled pink. She's laughing about that. Do you guys not say that? Sometimes I say things and you guys laugh like, oh my gosh, nobody says those things, Auntie. All right. So you guys know what time it is. It is Tuesday. And what does Tuesday mean? Medical Rundown Tuesday. And listen, today's topic, whew, last night I was thinking to myself, Sandy, you got to get to bed at a decent hour and get some sleep. So at least you can say today, I feel well rested. I would be lying if I said that. It is World Sleep Day coming up on March the 15th. And I must tell you that sleep is something that is elusive for me. And I think it's all my fault. But we've got the experts here in the studio today who are going to tell us how to get better sleep. Shamari is in the house. So first of all, Shamari, good morning.
Good morning. Good morning. I was about to say there's finally a day for me. World Sleep Day on March 15th.
I know.
Don't worry, Sandy. That means March 15th, you can sleep all day, right?
Yeah, I'm thinking,
It's-
why not?
Well,
you
well,
know?
it's a Friday, so I'm not sure that exact work.
They say you can't make up for it, but we'll ask the experts.
But the great thing is we're going to have on the program today Dr. Archita, who is our very own pulmonologist and also in charge of the sleep lab. Dr. Archita has been on the program before, if I recall. Or if not her, Dr. Harsha, I think we've definitely had one or the other or both
Yes.
on the show previously. And just to speak to the fact that Dr. Archita was our pulmonologist, so everything lung related. Dr. Archita is the physician that is the expert in that area. But she also was noticing that there was a lot of sleep apnea, a lot of sleep disorders. And through her other specialty, she was able to convince us early days that we needed to have a top-notch sleep lab so that she could actually figure out within the population some of these issues and would be able to help alleviate some sleep disorders, which if not dealt with actually lead to much more catastrophic types of ailments further in somebody's life. And then along the way, we got so busy and we wanted to once again always build out the different departments to have as many experts as possible. We got Dr. Harsha with Dr. Archita. We have a full team there now to be able to deal with everything sleep related. So we're excited to be able to have both on the show here with us today.
Yes, Dr. Archita, I think I'm going to come and see you soon because I'm just not getting the sleep that I know I should be. In fact, Dr. Archita, welcome again. My apologies to the program.
Good morning.
Recently, I went to the ENT, and I think Shamari knows that I was having some issues there. And I went to the ENT, and he said, "Tell me about your sleep habits. Like, what time do you go to bed and what time you wake up?" And when I told him, his eyes kind of opened up, and he's like, "That's not enough sleep." And I'm like, I know. There's only 24 hours a day.
It's everybody's story these days.
All right. So, Dr. Archita, thank you again for joining the program. And Dr. Harsha, also here with us. Good morning.
Hi. Good morning, Sandra. Good morning, Shamari. Good morning, ma'am.
Yes.
Morning, everybody.
To all of our listeners. And of course, I think it's important that we have these discussions around, they have every single month, there's a number of different health and wellness days that are on the calendar. But it gives a good opportunity, Shamari, for us to highlight these important things. I mean, World Sleep Day sounds like a lot of fun. Like you said, a lot of people are probably thinking, oh, this is an opportunity for everybody to sleep. But in fact, this is really about highlighting the importance of sleep in your life and how, sleep touches every aspect of our physical and mental well-being as well. Dr. Archita, I read somewhere that you could actually go longer without food than you can without sleep, because
That is
that's
very true.
how important sleep is.
That is true. So most of us think, sleep is something you do when you have time and, you want to utilize that time. To be
Mhm.
honest, sleep is almost as important as food or water or, generally exercises for us. It's a strong pillar in our health, which we don't realize. Most of our healing and repair and growth
Mhm.
happens during sleep. It gives an opportunity for the body to reset and restart again in the morning. So it's important we consider sleep as an essential aspect of our health.
Mhm.
And I'm sure all of you are aware, sleep deprivation has been used as a torture technique in in crimes of war and in other things, because that is something that is extremely difficult to cope with. You may be able to deal without food for a few days. People can survive, but 72 hours of no sleep can actually kill people.
Wow.
Hmm.
Pretty crazy. So hashtag World Sleep Day is trending on social media today. And the theme for this year is sleep equity for global health. And
Hmm.
so this theme recognizes that there are actually measurable differences in sleep health quality across various populations. So can we talk a little bit about that? Is it really the countries that are struggling in wealth and wellness and all these other things that are more sleep deprived?
To be very honest, it's not just the countries. Of course, there's a cultural difference, and there have been studies which show people in Japan sleep much shorter. European countries are not too far behind. It's also a culture around sleep. So, no, it doesn't affect just the West or the East. It affects almost every body. That this is a global problem. There's a global burden of sleep deprivation around. However, it also varies across the strata. Of course, there are cultural differences between different places and different countries or continents, but also among the strata in society. So some people are not able to get enough sleep because they are, they're jet lagging. They're moving from here to there. There are some people who need to work shift work. There are people
Right.
who have to work night duties and they have no option and they can't get that much sleep. So, equity is difficult. Equity in terms of monetary terms is difficult. Equity in terms of, your voice in society is difficult. And so is equity in sleep difficult. But the aim of this observance of the World Sleep Day and for us to talk to people and come across on radios and, talk about sleep is the more aware you are about it. If you know you have a right to it, or if you have a need for it, you're
Mm.
going to be more, likely to be more cognizant of the fact that, yes, I need to find time for my sleep and I need to, adjust my sleep patterns or my day routine, so that I can accommodate more sleep. So
Yeah.
that's
And
the reason for this discussion today. And the World Sleep Day is, the
Mhm.
theme this year.
and Sandy and Dr. Archita, just to mention that even if you look at the culture within wearing it as a badge of honor, I even remember probably even
Yes.
in my department of tourism days, we used to, it was like a badge of honor to brag the amount of sleep you got because you were working so hard, right? Or you're so
Mhm.
busy that I could only get 3 hours of sleep. Oh, you think you're busy? Well, I got 2.5 hours of sleep, and that's been ongoing for the past 2 years. And it
Mhm.
becomes a part of the culture where you think to work hard, to be successful, you need to sleep less. Now,
Yeah.
obviously, you need to prioritize and be organized and get things done. But actually, wearing as a badge of honor, I think at times makes people think it's okay to be
Yeah.
sleep deprived going through your day. And don't worry, I'm going to have that shot of coffee every 3 hours and keep going to show that I'm actually working hard.
Yes. Wow. Yeah, no, I totally agree with you, Shamari. And I don't know what happens. I think my nights creep up on me so much more than I realize. I know we're going to get some good advice here on how we can get better quality sleep and whether or not, professional intervention is actually required and how to know when to pick up the phone and call Health City. So this is really, really important. So there's two things. There is sleep quantity, so how long you're sleeping, and then there's actually sleep quality. So, tell us a little bit, Dr. Harsha, about what the difference between these two, and Dr. Archita, of course, what are the difference between the quantity and the quality of sleep, and which is more important if you had to pick, of the two, I suppose.
Yeah. I mean, sleep quantity is like the time, the length of the time that we sleep, and the quality is, are we reaching all the stages of the sleep? Like if we are, so that is the quality. So basically, there are four stages of sleep where, in stage one, it is like the superficial sleep, where and in the stage two, it lasts for some 20 minutes, where we what to say, uh, we just go into the depth of the sleep. And in the stage three, we say it as delta wave sleep, where actually, which remains for a longer time, about 1.5 to 2 hours. Then again, there is rapid eye movement sleep, like where
Mhm.
we are in the sleep, but again, we that is the stage where we dream. So these cycles keep repeating. So we have to cross all the four stages. So, but if this is not happening, or then maybe then we say that we are not having adequate sleep. So one has to pass through all the stages.
Mhm.
So this is sleep quality, but and also sleep quality means like there is a latency of a sleep, the time when we go to sleep.
Mhm.
So when we are on the bed, and the time where we actually go to sleep, that is sleep latency. So that is also, and sleep wakening in the sense, are we frequently waking up
Mhm.
during the time of the sleep? So so that also adds to the quality of the sleep. And also, like if we are having a short span of sleep,
Mhm.
even that adds to the quality of sleep. So all this together, we can say that there is all this measure the quality of the sleep. Of course, the quantity of the sleep is how longer we are sleeping. So that also varies. Like with the age, the
Mhm.
length of sleep will also vary. Like a child can sleep for 12 hours, and as we all age, the amount the I mean the length of sleep will also reduce. It can be they say that older people, they sleep very less because they do not get sleep. So maybe they'll be sleeping for only 4 or 5 hours. But especially the working class is the we say it as about 20 to say 50 years, or 45 50 years. So we say that they need to sleep at least for 8 to 10 hours. It can, as Dr. Achita was saying, it can vary depending on the work and culture and all the things. But
Mhm.
actually, we are supposed to sleep for that many hours if we have to have a good quality and quantity of sleep.
Mhm. Hmm. Yes, it certainly seems like sometimes it can be a bit elusive. I see some people in the comment section already. Good morning to Delcy, who's joining us from Miramar, Florida this morning. Stephanie, I think Stephanie has a question. She says pediatrics as well. I didn't see the first part of that, if there was another question. But you talk about the importance of everybody getting really good sleep from basically the day that you're born, even before you're born. Sleep is important. And Jen, it might change a little bit throughout your life cycle, but it remains a really critical and important part of your life. So, how do you recognize? You talked about some of these things that can happen, whether you're sleep waking, or you're not getting enough sleep, the quality of your sleep is poor. How do you actually recognize that something might be amiss with your sleep?
Usually, the first symptom one would recognize when they're sleep deprived is that they do not wake up refreshed.
Mm,
They might find that they're not falling asleep. Of course, that's an obvious symptom which a lot of people who either have or perceive to have insomnia will
mm,
find themselves awake in bed. They find it difficult to fall asleep. They wake up several times at night, or may wake up unrefreshed. Another way of assessing quality of sleep is how tired and sleepy do you get through the day. If you are dozing off at meetings in front of your computer screen while reading a book, while you're off guard and you're maybe sitting in front of the TV, if there are episodes where you tend to drift off, it indicates that you probably are not getting enough sleep.
Yes.
So these would be the the first alerts. If you feel tired all the time and you're not waking up refreshed, that's I believe one of the biggest indicators of your quality of sleep.
Hmm.
Having said that, everybody has a different threshold for sleepiness as well. So some people, even though they may be sleep deprived, may not manifest all of these symptoms, right?
Right.
Because they're always on the go. They're type A personalities. They need things done. So
Mhm.
like I said, there are many aspects. Some of these are this. Some people may just experience brain fog. They may feel as though they can't focus, or they're losing memory, or they're
Mhm.
just getting irritable. So these are subtler signs of sleep deprivation, and it eventually leads to some amount of cognitive impairment.
Mhm. And when we talk about the benefits of quality sleep, I mean, I'm really again surprised at how important it is. But everything from assisting with good blood pressure management,
Hmm.
appetite management. Years ago, they learned the connection between lack of sleep and weight gain,
That's true.
hormonal changes. So a lot of people who are looking to lose weight, they have to do the right things in terms of their diet, but they also have to make sure that they're actually getting enough sleep as well.
That's true. So you would be surprised, people who join the, a bariatric program, which is like a surgery or a weight loss program to lose weight. The first thing they need to be, or among the few things that they initially need to get tested for, is if they have any underlying sleep related problems, including sleep apnea, which is quite common in people, who are above a certain weight range or a BMI range. And you'll be surprised that, that there's a strong correlation between obesity and sleep apnea, and sleep apnea leading to obesity, or sleep deprivation leading to obesity. So it's something very important. Of course, hypertension is a very known risk factor. I mean, people are very prone to having hypertension if they're sleep deprived, to developing diabetes for that matter. Poor immune responses. They can't, fight off infections or subtle infections. They're always falling ill because of sleep deprivation. Common phenomenon among people who are sleep deprived due to shift work or because of life stresses.
Mhm. Hmm.
Yeah,
Very
like
great.
there are conditions like we say it as a, I mean, classically it was called Pickwickian syndrome, where someone is obese and he has a metabolic disorder like diabetes, hypertension, and they have OSA, obstructive sleep apnea. So this is like a combination where, like you have to treat it, otherwise the other thing will should like they can have uncontrolled hypertension, they can have uncontrolled diabetes, and they keep on increasing the weight, but they cannot lose weight because they have this obstructive sleep apnea where they are not sleeping well. If we tell them to do the physical activity, they are not able to do it. So this is like a vicious circle which will, I mean, we have to break it somewhere. So yeah, we'll come to that, I think, how we can help them, like
Mhm.
yeah. And also but in someone at an younger age, so definitely someone having a good sleep is very important. As I was telling, in the stage 3, that is where most of our growth hormones, they are released, and uh, uh, like we all grow, and like that happens
Mhm.
during that stage. So someone not having that stage of sleep during the childhood,
Mhm.
so they can have a reduced growth, like a stunted growth, or many other developmental and hormonal problems as well.
Mhm.
Yeah.
Wow. Let's look at a few comments. And don't forget, folks, you can join the conversation 936-2626. And you can always call us on WhatsApp as well. Phone lines are open. So Miss Dean says, wow, OMG, Sandy, I'm very much sleep deprived, 3 hours most nights and no sleep whatsoever in the days. Oh my God, 3 hours a night does not sound good. So Miss Dean should be making an appointment to come and see you guys. I mean, is there any way that you could get? I don't know if there's anybody in the world, but is there anyone out there who could be getting 3 hours and it's all 3 hours of quality sleep and they actually don't need any more? Is that possible?
Well, there are outliers. When we say an adult needs between 7 to 9 hours of sleep, there are always outliers. There are short sleepers and there are long sleepers, people who can get away with less and more. We're talking about 95% of the world's population would need, adult population would need this. when we talk about plus or minus 2 standard deviations. I
Mhm.
mean, that's a statistical term, but obviously there are outliers.
Mhm.
However, one can get used to a lot of things. Does
Right.
not necessarily mean that those things are healthy, right?
Yeah.
So, if you have made your lifestyle to adapt over a period of time with less sleep, you probably may be able to get away with it for some
Mhm.
time, but it will eventually catch up, either in terms of ill health or weight gain or cognitive decline. So,
Yeah.
we can exploit ourselves to a certain degree, but at some point
But
it
no
will
more.
catch up. Yeah.
Yeah.
Yeah,
Damien.
like
Yes.
sorry. I have seen a guy. He was saying that he can never sleep, and but still he's doing all his work, all the activities, like and
Mhm.
he's working harder and harder, like I mean physically
Mhm.
also, so that he can sleep. But still he's not able to sleep. So that is that we cannot say that he's like a superhuman or something. So definitely we have to see what is the disorder lying behind that. Like sometimes there
Mhm.
may be neurological disorders where they cannot sleep, so we have to address it. So yeah.
Mhm. Hmm. Wow. All right. Damien says studies have shown that going too long without sleep can impair your ability to drive the same way as drinking too much alcohol. Being
That
awake
is
for
true.
at least 18 hours is the same as someone having a blood alcohol level of 0.05. Wow. And he
True.
then talks about the 24-hour comparison. So, I mean, it has happened to me before, and I try not to do it, especially when I'm driving overseas. But even in Cayman, it's extremely dangerous to drive when you are fatigued and you're tired, because it's like you lose blocks of time when you're driving. You're like, oh God, I've already reached this point in my journey home, and you don't remember. You don't remember being cognizant of, like, going in the roundabout and passing certain things. So sleep deprivation definitely, driving, working with heavy machinery. There's a lot of things where it can be detrimental to your life and possibly put other people at harm as well.
True.
And when you find that you have to turn up the radio a little bit louder and roll down the window to keep yourself awake, you need more sleep. Damien says oversleeping is also bad for your health. So is there, I mean, obviously, I think when most people talk about sleeping, they're talking about, they look at the deprivation and quality side, but there such a thing as getting too much sleep?
Yes, there are such conditions. If this is a pathological condition, it's known as hypersomnia. So there are disorders where people will have excessive sleep, and those need to be addressed differently. These disorders include a more popular term called narcolepsy, or a more popular disease called narcolepsy. However, that's a disease state. Some people tend to habitually sleep very long too. There was a very interesting study in the past where people were tested for diabetes. I mean, diabetics were tested for their sleep patterns, and it
Mhm.
was noticed that if somebody is sleeping less than 7 or more than 9 hours, there's a curve where if you fall between that time, your diabetes control is much better. But if you are less than 7 or more than 9 or 10, you're more likely to have poor outcomes with diabetes. So yes, excessive sleeping can be harmful if this is not part of a disorder that's causing it. And if it is part of a disorder that's causing excess sleeping, then you perhaps need to be evaluated for it any which ways.
Hmm.
Yeah,
Very,
there is an
very
interesting
interesting.
tick disorder in African countries where they can get bite with the ticks, and
Sleeping
and they can
sickness,
sleep for many days. It's called sleeping sickness. So,
Yes.
anyway, even if you sleep more or less, so
Wow.
then you get evaluated.
Yes, you definitely speak to an expert, because that's, again, isn't normal. It was so interesting recently, Dr. Archita. I saw something where it talked about, you're talking about, that kind of sweet spot, if you will, about how much sleep you should actually be getting. I saw something that said for people who fall asleep during the day, and I know
Mhm.
there's, different research about naps and whatever, but people who are falling asleep during the day, that's an indicator that they're likely to have a shorter lifespan. And I thought, what? I thought napping was good. So, do you know anything about that particular study?
Lot of mixed data there. I think I would put it simply as it depends on who is napping
Hmm.
and what your underlying sleep patterns are. So if somebody who sleeps adequately in the night, between 7 and 9 hours, as we mentioned, is doing well through the day and naps as a habit, perhaps not a good idea. Somebody who's usually an insomniac and who cannot sleep overnight,
Mhm.
it's a very bad idea to take naps in the daytime because it pushes your, your pressure for sleep at night. It doesn't allow you to fall asleep easily at night. But if this is somebody who does a shift duty work and who's trying to catch up on sleep, or somebody like a student who's been studying really hard for an exam the whole week and wants to catch up on over the weekend, or so napping in those individuals, it can be fine. But somehow we always misunderstand napping. Napping is usually what we call, a power nap. Technically, is nothing more than 20 minutes of sleep, or up to 30 minutes at the most. It's not like sleeping for 2 hours that you call a nap, right?
Yeah.
So we have to be very clear about it. It's a catch-up sleep that some people can take when they are, they're sleep deprived for a short duration and they want to catch up. It's not a bad idea. However,
Mhm.
if you're doing it because you're sleep deprived through the night and you're not sleeping, you sleep late, you have poor sleep habits or sleep hygiene, as we would like to emphasize, and then you're trying to take a nap because you can't help it, that's not a good
Mhm.
idea.
Yeah, that happened to me on Saturday in the sofa. Um, no, actually, that was Sunday. Yeah, a couple hours. So that's not a nap. All right.
Uh-huh.
Leanna, Leanna says, what about those who can barely sleep? So people who are having this issue actually falling asleep and maybe even staying asleep, those again are indicators that something is definitely off.
So people who are having difficulty falling asleep or staying asleep typically have a condition we know as insomnia.
Mhm.
And a lot of times insomnia is for real. A lot of people will have it for no reason whatsoever, just some people will have it due to hormonal changes. Some people will have it due to stresses in life and anxiety and depression. It could be an association with these conditions. And the idea is we need to assess it a little better. It's always a good idea to have a discussion with your primary care doctor or come and see one of us and we can talk about it. If
Mhm.
this is insomnia, which is what we know as primary insomnia, due to no other, you know, whatsoever valid reason or other diagnosis that we can label as, then it's probably requires a multimodality treatment, could be
Mhm.
medications for sleep, could be a psychiatric assessment to assess for any other comorbid or other problems that that person may be having, and of course, cognitive behavioral therapy, which therapists can provide to help them sleep better. If
Mhm.
this is insomnia, which is more perceived insomnia, there's more lot of sleep maintenance problems, then there is a good indication to assess for any underlying sleep disorder, which is waking these individuals up, and then
Mhm.
you feel as though you've not slept at all. And this is very, very common. You'll be surprised. We've had people coming to me saying, "Oh, I can't sleep and I can't stay asleep," and lo and behold, we find, and they're so apprehensive, saying, "I can't do a sleep study because I know I can't sleep." And when we do the sleep study, they are sleeping, but they wake up so many times because they have underlying sleep apnea or some other medical condition, which is waking them up. So it gives you a feeling that you have sleep, you're not sleeping, whereas what is happening is you're waking up so frequently that sleep is not sufficient. Yeah.
Mhm. Mhm. Wow. Okay. Evelyn has a question. She says, I get 5 to 9 hours. Sometimes is that good? Plus, I have extra energy at nights. I will clean any hour of the night, mopping, doing laundry, and not feeling tired. So if you have this, and I think this is kind of what happens to me sometimes, is I feel like I get almost like a second surge of energy around 9, 10 o'clock at night when I should really be winding down. But how I know that it's really just me kind of pushing myself is because if I go and I put my daughter to bed and all the lights are out and I lie down, I fall asleep. Right. But then I'll jump back up at 11 o'clock, be like, oh man, I got things to do. Do in cases like that, like Evelyn, do you say keep mopping, keep sweeping, or do you say no, put down the mop, get away from the computer, and just go in a dark room and lie in bed and sleep will come?
That is true. I think the better answer is, this could be a part of what we know as phase delay. Some people are more alert in the night. You've heard of night owls and,
Mhm.
morning larks. So of course there can be a pattern where your brain is tending to be more awake at night.
Mhm.
And some people have this issue. It's more a habit kind of an issue. You'll see a lot of teenagers and adolescents because they have more me time at night. Or even, adults who will tend to choose to stay awake at night.
Mhm.
Um, I have only one thing to say. If this is in sync with your lifestyle, you can wake up late and go to work late and catch up on your sleep, get those 7 to 9 hours of sleep by sleeping late and doing activities at night. Maybe you can do it. I'm giving you a real life solution. I'm not talking about, what's ideal. But I have a feeling that a good sleeping pattern, maintaining a ritual where you are going to try and sleep at the same time every night and wake up in the morning at the same time, something we know as sleep hygiene, is a very important aspect in
Mhm.
actually letting you fall asleep at the right time, and follow your own body's biological rhythm. So when we say there is a phase change, we are either out of sync with our biological rhythm or circadian rhythm. So that's when you can't fall asleep at the right time, and you want to sleep late or you want to wake up late. So if
Mhm.
this is not something you can afford to do with your work patterns, you have to wake up at a certain time to reach your child to school, to get to work, then
Mhm.
perhaps it's a very good idea to form a pattern that you go to bed at least 8 hours prior to your wake time. For most adults and for even school going children, that's a very relevant time, right? You have to wake up at that time. So you count back and say, okay, this is going to be my bedtime, and let me make every possible effort to fall asleep at this time, right?
Mhm. Mhm.
And if you still have
Wow.
issues, well, don't start mopping, don't start sweeping. You maybe do something more dull.
Yeah.
Maybe read a book or listen to music or white noise. Try and form a pattern. There will be days you will not be successful initially, but once your brain is trained, it's
Mhm.
quite easy for people to fall asleep, especially if they're sleep deprived. Yeah.
Yeah. Well, Evelyn, I think this is a good insight into what's going on with her. She says, yes, but when I lie down, I'll be out in 5 minutes. So that's
Aha,
an indication that she's probably not a night owl and she really needs her sleep. So
that's
she,
right. And you're trying to push it off to accommodate other things,
yeah.
right? You're fighting sleep.
Yes. Oh my
Right.
goodness. So
Yeah,
interesting.
when we want to sleep and we're still thinking about like what is to be done,
Hmm.
that is where like the sleep latency can increase. So that is a disorder. So we
Hmm.
cannot say that it is a normal or it is my pattern. So yeah, that's what we need to address. That like one
Hmm.
should go to sleep within the time span.
Yes. Um, Now, I see Stephanie saying she was clarifying if the doctors are qualified to serve pediatrics. One of her sons is under the care of many specialists, sleep medicine and pulmonary are included. So children can also suffer, and babies even can suffer from some of these sleep disorders. How do you identify it in children? And do you guys have the medical experts available to assist with children as well?
So we can perform sleep studies. I'm sorry.
No, go ahead.
No, sorry. I thought there was somebody talking in the background. I'm sorry. So there are we can perform pediatric sleep studies if that's your question. Usually above the age of 5 years. However, as a practice, to be dealing with smaller children, I don't think both of us are pediatric, specialists. So it's probably a good idea to continue follow up with your own pediatric specialist and pediatric sleep specialist as well.
Mhm.
However, if it's a question of getting a sleep evaluation done or a study done, that can be done.
Mhm.
Yeah, yeah, like as I told you, like the sleep disorders can be of different varieties. Like in a pediatric age group, the sleep disorders are different from the sleep disorders in an adult. So mainly, so definitely we have the facility where in this lab we can do the whole I mean level one means we get all the parameters, so neurological also. So definitely the study can be done, but in a
Mhm.
pediatric sleep disorder, so mainly other specialists also should be involved, like a psychiatrist and the pediatrician and the neurologist. So it is like a multimodality. So definitely, yeah, as a specialty, we ourselves cannot do that. Yeah.
Mhm. Mhm. Very, very interesting. Now, we have here, I mean, you just told us what insomnia is, sleep apnea. I think most of us have an idea. We've talked about narcolepsy, but what is this restless leg syndrome? What is that exactly? I've heard of it, but I'm not sure I know what it is.
I'm sure you've seen it more than you've heard of it.
Oh,
Have you seen people keep moving their legs up and down while they're talking to you or twitching their legs at their
yeah. I
ankles?
just thought that they were a little bit on the hyper side.
That's one of the symptoms of restless legs. Typically, it's a neuropathy, it's an irritation of the nerves, and people, when they're
Oh.
trying to go to bed, this gets much heightened. They'll keep moving the legs and they can't fall asleep. Some people may keep continuing to do this or have what we know as periodic leg movements in their sleep, and that can, disrupt sleep and can be a contributor to daytime tiredness or early morning tiredness. And it's a neuropathy, so there have been strong associations with other neurological conditions of this condition. So it's
Mhm.
something important to address if somebody is symptomatic with it and finds it difficult to fall asleep with it, or is
Mhm.
waking up at night due to the restless legs or periodic limb movements.
Hmm. Very good. So we have a few more questions. Damien is asking about jet lag. How long do you sleep, and is there a formula for time zones? So this is a very interesting question. Last year I took a continental trip to Greece, Shamari,
Yeah.
and I thought to myself, "Oh my gosh, this is going to be so weird shifting time zones." And for the first couple of days, my body was a little bit confused. But on the trip, I was like, I'm just going to sleep pretty much the whole way there. Is that a good idea?
Sorry, can you repeat your question? What is a good idea?
Yeah, if you just sleep on the trip, like if you have a 12, 13, 14-hour flight to get into a totally different time zone across the world, is it a good idea just to sleep the entire way there and then you wake up and your brain thinks, oh, yeah, I'm in this particular time zone now? Are there any secrets?
Yeah, that's true. I mean, see, I think most of the times you can't help the sleeping, right, on a long
Yeah.
flight. So that's fine. But there are a lot of things you can do. A lot of times when you are, depends on which direction you're traveling, there are ways to cope. It's a good idea to consider if you're, especially if you're a frequent traveler and can't afford to be a fog, having a brain fog when you land, to use melatonin, and you
Mhm.
start taking it at the time, whatever your the time zone at your destination time is. You start taking, you're resetting your sleep pattern to that time zone a day prior or 2 days prior, right? So it may take time to adapt, especially traveling. You know, can from west to east can be difficult for people. Some people say east to west is more difficult for them, but it's basically important to maintain a routine. Try and adapt your sleep pattern to a time zone when, say, if you're going to land 12 hours into a day, you want to start sleeping at that time for a
Mhm.
few days. Deprive yourself of that sleep and then try to sleep at that time, or use melatonin for that matter at that desired sleep time, and then try to catch up when you're there. By that time, your biological clock would have adjusted a little bit.
Mhm.
That's all I
So
can
the
recommend.
melatonin should be taken when you're trying to go to sleep.
That's right.
Yeah,
Yes.
I mean, if at all, we should try the natural way. If at all, if it is usually the jet lag, like, it can remain for 2 to 3 days, I think. Even otherwise, if not, like, if you're not able to sleep, otherwise, also after that, also, maybe then we should try that. I feel, yeah. Eh,
Mhm. Mm, very good. All right. Siobhan says, I have I have insomnia and it's horrible. It sucks. She says, good morning to First Lady Jayanne. Um, hmm. Okay. Might need to get you some help there, Siobhan, about that. Shannon says, my doctor Archita is on. And she says, much love to her. I'll be seeing her
Thank you.
tomorrow.
Oh. Hi, Shannon.
So Damien says insomnia, getting too much sleep or not enough sleep. Can that be a sign of someone who perhaps is suicidal, or more importantly, suffering from depression?
It is.
Mhm.
yeah. Insomnia can be due to depression, anxiety. So so that is why someone having sleeplessness, we definitely need to evaluate why it is happening. So there can be organic causes also. I mean, like someone suffering from an organic disease, like someone having a prostate who has to pass urine frequently. So he can, because he has to wake up, like, in between. But at the same time, if, as you said, like someone is not able to sleep, is not able to go to sleep, or whatever it is, like sleep breaks. So usual causes anxiety and depression. That is the usual, I would say, cause for sleeplessness. Yeah.
Mhm. Hmm. Okay, very good. All right. Somebody sent me a little private joke here on WhatsApp. They said, what do you call it when you have to sleep with one eye open? Bit of a sleep joke. Oh my goodness. So Liana says, I always need to take my afternoon nap because I tend to be moody and then I stay up late playing games until 2 to 3 a.m. So in a situation like this, probably try to avoid the napping and try to get sort of in a regular. It's hard because you gotta try to regularize yourself, right?
That's right. So this is something that we want to emphasize on. This is sleep hygiene. So you are taking a nap in the daytime because you're depriving your sleep at night.
Mm-hmm.
And if you could try and reset that a little bit by little, I'm not saying that one fine day I tell you sleep at 10 o'clock and you'll be able to sleep at 10, but you can try and prepone your sleeping time by a little bit. And then the pressure for sleep in the daytime will go down. The moment you have taken a nap, you've delayed your sleep again for the night, right? So probably for such an individual who wants to reset, and needs to reset, then it's probably a good idea to prepone your bedtime a little by little and try avoiding daytime naps. And a few days, of course, you'll be miserable, but eventually you might get back into your pattern. And if you need any further help, it's always good to see somebody to talk about it and see what more we can do about it.
Very good. All right, Liana, get that under control. Good morning to Emma. So nice to see you. So Evelyn says, whatever time I go to bed, I'll wake up the same time every morning between 5 and 5:30, even when I don't have to go to work. So again, that's about your body being trained, right? Getting into these patterns.
That is the strength of training of the brain over time. So that's exactly why we say if you form a routine, and it's not easy, obviously, but if you start forming that routine and you make a pattern that you're going to sleep at this time and wake up at this time, eventually that would become a habit. Yeah. It's about training your children or training your dog. You can train your own brain. We don't think of it that way.
Yeah, absolutely. All right. Diana says, good morning. What about those who fall asleep, but easily awake by any sound? So these are what we would term as light sleepers. I hear a lot of people saying, oh, I'm a light sleeper. They don't get into that. Dr. Harsha, you were talking about the different types of sleep and the rapid eye motion and that kind of deep.
Yeah.
That means that they're not going that deep, are they?
No. Rapid eye movement sleep happens when it is a form of deep sleep. I would say, like, there is a non-rapid eye movement sleep and there is rapid eye movement sleep. So in the non-rapid eye movement sleep, there are three stages. So the that is when, like, no, we say like there is beta wave when we are awake, and after that there is alpha waves, like, no, the brain waves changes. So in the alpha waves, one can be arousable. In that stage he is arousable, but after that there is delta wave. So in the delta waves is where someone is having a deep sleep. So that part should be for a longer time, at least for 2 hours. And then happens this rapid eye movement sleep, where usually there is movement of eyes, but otherwise there is motor paralysis. We say, like, no, like someone cannot move the body. That is when we get all these dreams and nightmares. So all this stuff happens in the NREM, that is non-rapid. Sorry, REM, that is rapid eye movement sleep. So someone not having these two stages, that is when we say they are like they're having only a superficial sleep and they're easily arousable and they do not get adequate rest. Yeah.
Wow. Okay. Right. Very good. Let me just sending a quick message to the governor's team. All right. So Ms. Dean, I think we answered this already, but you might have missed it. Can sleep deprivation trigger a nervous breakdown? Well, it can kill you in the matter of a couple of days, Ms. Dean. So I would think that a nervous breakdown is probably on the list before death. So yes, that's exactly how important sleep is. Liana says that anyone else rocks themselves to sleep, because I do. How do you do that? How do you rock yourself to sleep? Do you have a rocking chair? We talk about babies and some of the habits, and I always, when I listen to other parents, Dr. Archita, I hear people saying, oh, I'm constantly walking with my baby and rocking my baby, and I have to drive them in the car and do all of these things to get babies and young kids sleeping. When I was pretending to be Dr. Google during my pregnancy, I read, just put that baby in the crib and they will find sleep. Like, don't get into these habits of holding a baby to get them to sleep, of giving them a pacifier or any of this other stuff, because just like everything else, babies quickly develop habits. And so it's cute when they only weigh, maybe 6 pounds. When they're like a 10 and 15-pound baby, all of a sudden, oh, my poor back couldn't take it. So is that normally good advice with children? And I don't know why Leanna might still be rocking herself to sleep, but maybe somebody was rocking her as a baby. But is it a good idea with kids and even yourself to try to minimize how many things you have to do as part of your ritual of sleep?
True. So, I mean, it can be complex with babies, and because they have a lot of other issues, they'll sleep throughout the day, and sometimes they can't sleep at night, and that's when you want to sleep, and when you get impatient with your kids, that's what you do, right? Anything it takes to
Yeah.
make them sleep. But yes, I agree with you, Sandy. What is a good idea is to allow them to fall asleep naturally, form a pattern for them as well. And if you start early, that's extremely important. Keep the room dark, keep the room quiet, be there for the child, but you don't have to essentially move around. Or if they're not sleeping at night, or they're cranky and they're crying, probably there are other issues. And I'm no pediatric specialist, but all the same, there could be other issues like colic, or there could be earaches or stuffy nose, which is preventing them from sleeping. And so maybe you want to address that issue. If you find your child to be cranky, that rather than just soothing them back to sleep. And I mean, of course, there's not one way which will work for everybody, but this is a good idea that you allow natural sleep. And that's also true for your children. Why, when we talk about equity for sleep, this is one of the things I'd like to emphasize. A lot of young people, children, adolescents, they are, from a very young age, are now exposed to a lot of stimulation from media, from phones to laptops, to computers. And more screen time, the more delayed sleep. As it is, children, I mean, adolescents particularly, are likely to be more night owl kind of things, and they have phase delays. This new era is now bringing in a lot of poor sleeping habits, and perhaps advocacy for good sleep and good sleep hygiene for everybody. And this is our way of maybe trying to ascertain if there is some equity in society, is that we start at a young age to make people aware of the requirement for sleep. We talk to the people in general, to the population in general, where parents can then educate the children. If schools can incorporate that kind of training in their discussion. Children and adolescents are impressionable. If they can form good habits, maybe we'll have a new generation of people with good sleeping habits. So I think that's extremely important, and that's perhaps one of the reasons why we wanted to make this effort to talk to everybody and say, please form a good sleeping pattern. Sleep is important. Address sleep related issues. Don't just try to mask them with other things, right? Just as an example, you try to put your child to sleep. You want to do some other activity when it's bedtime. So try and find a better pattern around your sleep. Yeah.
Absolutely. All right. Improving quality sleep, go to bed early, maintain consistent sleeping and waking hours, even on weekends. I know it's tempting to sleep in on a weekend, but the idea is to try to maintain it throughout. Avoid coffee, large meals, and alcohol before bed. Sleep in complete darkness, which is something I'm looking forward to. But when you have a 7-year-old, it's a little bit hard. Change your bed sheets often. Get more exercise and reduce blue light exposure at night. And the one about getting more exercise, sometimes it's important not to get exercise too close to bedtime, because I know for some people that acts like coffee, like it's a stimulant, and then they have an issue sleeping.
So no exercise for 2 to 3 hours before your desired bedtime.
Yeah. And one trick that I have found that's a little bit useful when it comes to reducing the blue light exposure at night is there's actually a setting, and I'm sure Android has it as well. There is a setting on your iPhone where you can tell it like you want to start winding down at a particular hour. So you want to say, hey, my bedtime is 10 o'clock, 11 o'clock. An hour before, remind me. So it actually reminds you it's bedtime. You need to start winding down. But it also starts to decrease the light exposure on your phone automatically for you. So I think in terms of setting these, sort of automated things, that was really, really helpful for me. And because I lose track of time, like I'm like, oh my God, every night it's midnight already. How did we get here? So with this new timer, at least by 10 o'clock, it's telling me, you got to start winding down. It's soon going to be bedtime. So, folks, in recognition of World Sleep Day, March the 15th, the Health City team that's on Friday is here educating us about everything surrounding sleep, from sleep disorders, tips for better sleep, better quality sleep. And of course, if you find that you need professional help, let's talk now about sleep medicine at Health City and what services you guys actually offer.
So we have a full-fledged sleep lab at Health City at East End, and we also, so a typical person who has sleep-related problems would come to consult one of us, and we talk about what their issues are and understand during that interview what that issue is. And if then somebody does require further evaluation with what we know as a sleep study, there are various ways of doing it. So there can be individuals who will benefit from a home-based study, and there are individuals who will benefit from an in-lab study. So the sleep lab, as we call it, is basically it's not a lab where we run experiments on you. I just want to clarify that. A lot of people say, "Oh, I'm going to a lab." So it's basically where you are going to sleep. It's a bedroom. It's a comfortable-looking area. It just looks like any other bedroom, maybe a hotel room, and you have your own private space. And there's a lot of equipment that's put up on you by a qualified technician, where you get a lot of things to monitor your brain activity, your muscle tone, your breathing patterns, your the flow of air through the nose and mouth, the snoring, heart activity, or with the ECG, effective breathing, oxygen levels, and of course things on your legs to look for restless legs. So this is a full polysomnogram, as we call it, or a sleep study in the lab. So this is something which is done overnight. A similar study can be done at home without you having to come out all the way at night to a lab. And a technician usually comes and fixes people up with these kind of equipment. And in the morning, you take it off and drop it down, right? So these are the types of studies that we do. Depending on the number of parameters we are testing for, they can be level 1, 2, 3, or even 4. Technically, we usually do 1, 2, or 3 levels. A level 4 study is a very limited study, and it doesn't make much sense to do it in a well well appointed lab. So and we have very good technicians. Thankfully, we download the data, prepare reports, and then we discuss it out with patients, and then we talk about, okay, what is wrong and what's going on and what we found out on those studies. So the most important subset of people who can benefit from our evaluation would be people who have sleep apnea, who are snoring, who are not breathing well, who have low oxygen levels in their sleep, and that's waking them up often. And usually treatment options are discussed, and I think Harsha can elaborate on that. But and then they're given some treatment for the sleep apnea. If they have what we know as insomnia, and there are other comorbid conditions, people may benefit from other specialities, looking at them, somebody like a psychiatrist assessing them for anxiety or depression, or treating them for it. A therapist trying to give them therapy sessions, to help sleep better. So these are other things that we can do, or medications. If somebody has restless legs, we address that with treatment. So, the outcome of the sleep study will show us what further we can do for somebody. There are some people who have suspected narcolepsy, and then we can do an overnight study followed by a whole day of evaluating them as well. This is not for everybody, of course, but in people where we are suspecting hypersomnias or narcolepsy, and we do what we know as an MSLT study through the day. So these are what we offer through the sleep lab. And I think about the treatment options, obviously, Arsha probably will be happy to talk to you about.
Yeah, the large number of large group of people
That's
usually
a,
they fall into the OSA, that is obstructive sleep apnea, where obstruction is the cause. So in this population, we usually offer them CPAP PAP therapy, that is positive airway pressure therapy, where it can keep the airways open when they are sleeping. So this is the most commonly accepted, most common disorder as well, and also most accepted treatment as well. So it can be CPAP or BiPAP, depending on the severity of the obstructive sleep apnea. So we advise them CPAP therapy, which is a continuous positive airway pressure, or a BiPAP therapy, where it is a bi level positive airway pressure therapy. And also, we can give them different interfaces based on their severity of obstructive sleep apnea. So we also do a titration study when we know that they have obstructive sleep apnea. So the titration study is done to see what pressure to be set and what mode to be set, and if they require a CPAP or a BiPAP. So once we diagnose them with an obstructive sleep apnea, then we need to titrate them to see what advice can be given. So sometimes, in spite of giving a PAP therapy, patient can continue have symptoms. So in that, sometime we also have surgical modalities
Mhm.
where we can do the debulking. So because mainly obstructive sleep apnea, it is the upper airway which is causing them this obstruction. So there
Mhm.
are some surgical techniques where we can increase the room of the naso-oropharyngeal passage. So surgical, anyway, it is the last resort, we say. Yeah.
Mhm. And Damien is saying, does better sleep make you have better dreams, or lack of sleep gives you nightmares? I think it could be the times that you eat and also what you eat, like spicy foods. So any sort of correlation between what you're dreaming about and the quality of your sleep? I mean, nightmares might keep you up at night. But yeah, that's an interesting question.
So yes, if you're having an unpleasant experience in your sleep, obviously the content of your dream may turn into a nightmarish content, is what I believe in. But
Mhm.
there are nightmare disorders where people have repeated or recurrent nightmares. But it's to say that yes, eating spicy food, if you're having a heartburn at night, is going to wake you up with a very bad
Yeah.
feeling, and the content of your dream may become obviously unpleasant, and so you may call it a nightmare. But yeah, I'm not quite certain I can, authenticate
Yeah.
that very well about the content of your dream and your sleep quality.
Yeah.
But
Again,
there are people, yeah, yeah. With sleep
like
apnea,
dreaming
I've
it.
heard a lot of people feel they're drowning or they're choking and they're, so
Yes.
because they are actually going through that process where they can't breathe.
Uh-huh.
But content of sleep is something which is very difficult to pinpoint, and very few studies which can, large scale studies which can say what you dream is related to what, so yeah.
Oh, interesting. All right, some very interesting questions. Our audience members are always
Mhm.
curious about things, so I
It's
think that that's
good.
probably a good thing.
Dreaming itself is a big topic to,
Yeah,
to talk and discuss. Like, yeah, there are multiple factors which can affect your dreams. Yeah.
right, right. All right. Well, I am going to say you're probably going to have better dreams if you're getting better sleep, but that's just my layperson's opinion. Vicky says
True.
that she goes to bed at 7 p.m. and she's up at 3. Wow. I can't imagine going to bed at 7. That's early. I'm just getting home some nights at that time.
Yeah.
So,
She's getting her 8 hours.
yeah, that's for sure. Good for you,
That
Vicky.
is
Good
what
for
is
you.
needed. That is fine, I think. If someone is going
Yeah.
so early, then that is acceptable.
Yes, it's a phase advance. She's falling
Yeah.
asleep early. So there are phases of sleep. If some most of the times what we are considering people should do is what we're talking about. If you're following a circadian rhythm, you should start falling asleep at this time. But some people can have a little change in that phase. They can fall asleep sooner than when the expected bedtime or later. So,
Mhm.
she seems to have an advanced phase. So that's fine.
That's okay.
I mean, as
And she,
long as it works with her routine, it's fine. If it doesn't,
yes.
then there are things we can do to help
Right. She says, I love to sleep, no stress when sleeping. And of course, we know also, doctors, that, our sleeping patterns have changed as human beings have progressed with like technology and stuff. Because let's face it, years gone by, there were no street lights, there were any interior lights. So there was a lot of things that forced you at sundown to begin to naturally shut down the body. And
That's true.
so when you sort of start removing some of those things as well, I think, your body kind of gets back to probably what's a bit more natural for you.
That's true.
Um, Stephanie saying that most of the phones now have a blue light filter that you can actually activate and turn on. Rough Seas says, I knew there'd be some medication involved. And of course, to be clear, you only would prescribe medication if all else fails. Let's just be clear here.
That is true.
Yeah. All right, Shaka Zulu, good morning to you. She says that I found that by monitoring, I don't know if Shaka Zulu is actually a man or woman now that I'm thinking about it, but Shaka Zulu says I found that by monitoring my sleep patterns via a smartwatch, my sleep has improved tremendously over the years. And I can attest to knowledge is power because I also have, I don't do it as much anymore, but I used to have the, before I got my Apple Watch, I used to have the, the Fitbit. And the Fitbit gave me a lot of information about my sleep. And I think that's when I recognized how poor, not only am I probably not getting enough sleep, but the quality of my sleep. I seem to be waking up a lot more than I realized throughout the night. Even if I wasn't like consciously awake, my body was obviously doing other things probably than just sleeping. So thank you
That's
so much.
exactly what awareness does, Sandy, and that's what we're talking about. So the more you know about it, the more you think about it, the more you're able to correct it if something is wrong. Yeah,
absolutely. Yeah, for sure. So raising awareness here again, folks, around sleep. It's very, very important. World Sleep Day is going to be celebrated this Friday. Celebrate it with a power nap. And if you have any issues, again, any of these sleep disorders that we talked about here, everything from sleep apnea, narcolepsy, restless leg syndrome, sleeping too long, these are indications that you might need to talk to a healthcare professional. It's not about medicating you or over medicating you. It's about trying to give you that knowledge, that information, and maybe a path forward of how you can try to address it. And I can tell you that when it comes to sleep, these physicians are like, listen, if you can get better sleep on your own without any intervention, we just kind of point you in the right direction, make some good suggestions, then that's really what it's all about. So Rough Seas and everybody else, get more sleep if you can, get better quality sleep. And again, Dr. Archita and Dr. Harsha are here for you if you need to speak to a healthcare professional. Shamari?
Yes, and just wanted to also state that we were talking about the catwalk for cancer last week, and we raised $30,000 for the Cayman Islands Cancer Society. So, as always, we're looking forward to give back to the community and to help organizations that definitely help persons that are most in need. So, we're delighted that we were able to do that as well. And also to mention, when you were showing the photos of the actual sleep lab, we're very proud that we have a partnership with Tomlinson's that helped to fit out the sleep lab to make it as much as if you would be at home, so that you can actually being a bedroom type facility, so that everything that Dr. Harsha and Dr. Archita actually do from a diagnostics perspective work best possible, because you feel like you are at home. If you need any of the services or just a consult, 640-4040, and or info@healthcity.ky. And Sandy, just wanted to state that I feel a little bit jealous that you're so excited about the guest that's coming on after us. You've never been that excited about Health City guests.
Oh no!
But I guess I guess because it's Her Excellency, we can forgive you for that. And
yes,
also just to mention, we don't want to start any rumors. So somebody started messaging me about going to Greece with Auntie Sandy. So we were on the chamber travel group that had about 40 of us.
That had to be Johan. Nobody else is as mischievous as Johan in the morning. Jealous that I might start giving you his brownies instead.
Yeah, I notice how he disses your brownies so that nobody else will get. Right? But
reverse psychology. Yeah, don't pay him any mind, my dear. How did I know it was him? Anyway, yes, it was a group trip, everybody. It was a group trip with tons of people. And it was really, really a fantastic time. All right, guys. Well, thank you so much. Really appreciate it.
And what
happens, coffee helps.
Not before sleep.
Not before sleep.
Exactly. All right, folks. Have a good sleeping day.
Take care.
Thank you. Yeah.
We are gold standard sleep lab. We do in-lab diagnostic, split night sleep study, in-lab titration. When the patient comes here, we fix up 26 different channels and we study 8 different parameters, right from the head till toe. study all different things like brainwave, leg movements, their hand movements, whether the thoracic and abdominal movements, whether they're breathing or not, their oxygen saturations, their heart rate, all those things are studied throughout the night. And then morning, if needed, then we do a titration part. Suppose a person is having too much of obstruction, too much of snoring, then we put them on CPAP machine and then start titration.
August of 2015 is when we launched our sleep lab, and we felt that some upgrades were in place, were needed. A change of mattress, a change of the pillows, or the ambience of the room would do it good. And we were very happy when Tomlinson Furniture, Mr. Jim Ray and some other people from Tomlinson Furniture, came up with this idea.
We are so pleased to be able to work with Health City in this collaboration together with their sleep lab.
Sudden change is not digested by human mind and body. So if it is a home-like environment, they can adjust well and we can get a normal sleeping pattern.
So our goal was to not make this feel like a hospital. We worked with having some really nice paintings, some different touches, some throws, some pillows. So you really got a sense of feeling at ease. So when looking at the furniture pieces that we selected, we wanted to create a bright but calming sense. So we went with whites, neutrals, and also some blues. And with that, creating the atmosphere that was needed to get a peaceful retreat. We've gotten told so far that it has this hotel zen-like feel, and that's what we want. We wanted to create a space that's relaxing.
I like it. It is refreshed, lively, and when patients walk in, they won't see a clinic-like environment. They will see a comfortable home-like environment.
They've done a good job. I think we have a brand new looking room in the lab, and that should make it more pleasant for people to spend the night here when they're getting tested.
Pleasant sleep. I'm all about it. Love it. Absolutely love it. It looks lovely, I must say. And the room where you're actually getting your sleep is extremely important. In fact, I don't know how much you guys have thought about this entire process, but environment is everything. So one of the reasons that you could be struggling with some sleep is that your environment is too cluttered and there's like too much going on. You know what they say? Have you guys heard this before, that your bedroom should only be for two things? Sleep, and I'll leave your imagination for what the other one should be. That's why they don't recommend, I've broken this and I feel like, oh my God, I should have done this. Putting a TV in your bedroom. They're like, don't put a TV in your bedroom. Don't put exercise equipment in your bedroom. Don't, keep your bedroom simple. Have your bed, it's for sleeping. And the other thing, like I said, I'll let your minds figure that one out, but that should be it. And if you don't, and you have too much clutter in the room, it can have sort of a seeping in effect that can then impact your quality of sleep and so on as well. So Stephanie says, what a great collaboration. Yeah, the room there looks fantastic. Damien enjoyed the show, said very interesting show and answers. Thank you, Health City. Always, they come prepared and come with good stuff. Good morning to Andrew. Shaka Zulu says that I found that by monitoring my sleep patterns via smartwatch, my sleep has improved. Yes, I think we read that one already. Very good. Do your part. There's a lot that you can do. The medical experts don't come on here to say, oh, come run to us for every little thing. They're letting you know how to improve the overall quality of your life, things that, quite frankly, you can do on your own. And then in extreme cases where you've tried everything, you've done everything, and you feel like, oh God, I don't know what else to do. I can't help myself. Then they're there as consultants and, of course, to offer any additional assistance that you may need. And I have found from my own personal experience that every time I go to Health City, their MO is not to write you a prescription. It's to say, okay, what is it that you can do on your own, even in terms of my A1C number. Sandy, these are the things that you need to do. Okay, you lost 5 pounds. Keep going. Lose another 5, lose another 10, whatever, to be able to help you on your own. Yeah. Okay. So Soka says, oh, hell yes, my TV is in my bedroom and it's been on for 25 years. You know what I'm starting to find, Soka, is I think it's, again, talking about developing bad habits. Now the habit is when I turn on the TV, that's my cue to start falling asleep. That is what puts me to sleep, the TV. But it can be, for most people, it's actually stimulating you and stimulating your brain. And I'm sure, Soka, that you've recognized that sometimes you go to sleep, the TV's on, and you actually dream about what's on the TV. So it's like you're not really getting that nice, peaceful sleep because your brain is hearing the sounds from the TV and the shows. And that's happened to me quite a bit, where I woke up and I'm like, well, why was I dreaming about Madlock or whatever? And that's because that is actually what was on the telly. So there you go, honey. Yeah. Soka says that she can't sleep without sound. Really? Wow. I can sleep with sound, depends on how tired I am. But yeah, I don't need sound in order to sleep. Interesting. Very, very interesting. All right, so we've got the governor coming up at 9:00. Honey, yeah. I can't use my fake British accent when she comes on. All right. I think she's got about 20 minutes for us. Not a whole lot of time, so we're gonna hit it hard. Say hello. How are you? Get your questions answered. Let me just see. I need to. We have an analysis here. I'm going to read that to you guys afterwards during our open mic session. Yep. Wow. All right. Let me see here. March the 12th, that's today, marks Equal Pay Day this year. This is talking about the inequity between women and men and what they tend to make. So listen to this. This is Equal Pay Day in the United States, a symbolic date representing the number of days women have to work into the current calendar year just to make the same amount of money men make in the prior one. So put it this way. To make 12 months worth of a man's median wages, a woman has to work about 14.5 months. In dollars and cents, for every dollar a man earns, a woman is paid 84 cents, according to the National Committee on Pay Equity and the Equal Pay Today campaign. So this is based on earnings that have been analyzed for full-time workers, year-round workers from the U.S. Census in 2022, which was the most recent full-year data that is available. So if part-time workers and those not employed year-round were included, the gender gap is even worse at 78 cents on the dollar. And the National Campaign, that says the National Campaign Director of Equal Rights Advocates and Director of Equal Pay Today. Pretty interesting. So the size of the actual wage gap between men and women will widen or narrow depending on age, level of education, choice of occupation and tenure, as well as race and ethnicity. So all of these things, folks, still make a huge difference in what you're going to make. Stark reality here. The gender gap is typically widest when comparing the earnings of white men to Black, Hispanic, or Native American women. So again, anyone who's in the minority, the gap is far greater. Generally speaking, the gap is narrower in a given job when men and women are in their early to mid-20s, when they're new to the workforce and before children come along, and also when comparing wages by title, tenure, and education level within a given field. But no matter how you slice and dice the data, there are very few scenarios in which women on average earn the same as men. And you can imagine even less scenarios where they would be earning more. It says, indeed, in its latest analysis of median weekly earnings last year by occupation, the Institute for Women's Policy Research found that women earned less than men, not only in all 20 of the largest occupations for men, but also in all 20 of the largest occupations for women. Wow, that's pretty wild. Among the largest occupations for women, the most Egregious pay gaps were among financial managers. Women earn 71% of every dollar a man earns. Retail salespeople, I'm surprised about retail sales, 72%. Education and childcare administrators, 79%. And administrative assistants, what? Men are making more as admin assistants? 80%. And managers at 81%. The narrowest gap was among cashiers, where women almost have pay parity at 98% with their male colleagues. In other words, the role of being a cashier, they're pretty much making the same, although men are still edging out women by 2%. That's pretty crazy. So while the overall gender pay gap has been narrowing over time, they were comparing numbers from like 2005, and so on. It still remains a significant concern. And the president of IWPR says the gender wage gap is a national disgrace. Even in professions typically dominated by women, men can earn far more doing the exact same job. Equal pay for equal work has been the law of the land for more than half a century now in the United States of America, yet women still cannot get fair treatment when it comes to employment earnings, and it's worse for women of color who face rampant racial discrimination in the workplace, in addition to ongoing pay inequalities. My goodness. The good news is that there's now more multiple efforts that may over time help to reduce the problem. They include an increasing number of state-level pay transparency laws and bans on employers asking job candidates for their salary histories. Oh, that's interesting. Which can help chronically underpaid women gain more of an equal footing than when they apply for new jobs. There's also a ban on federal government agencies asking job candidates for their salary histories, and a proposed rule that would prohibit federal contractors from doing the same, as well as requiring them to post in their job ads the pay for any given positions. And if you can believe that this is a problem in the United States of America, I'm going to challenge you and say that Cayman probably has double the problem. But I would be interested to know whether or not we have any of this data through the ESO information available to us, and why, quite frankly, nobody's talking about these things at a national level in this country. Who's talking about equality of pay for us here? I dare say nobody. Meh. No bueno. I was, speaking of that, I was having a look at something, I think it was yesterday or day before, actually, might have been late last week, talking about the significance of women having to, once you start to have children, apparently this is a detriment to, your ability to earn and to have a job and everything else as well. So look at this one that I found that it made me pause. In The Economist, a new study of 134 countries finds that women's labor market participation falls after childbirth almost everywhere. And this, again, is impactful. Women need to be supported because the communities that really offer proper daycare and childcare, paternity and maternity support for women are the ones that have less incarceration, less mental health issues. They just function better as a society. So that's precisely why we need to talk about some of these things. So almost everywhere, women's careers suffer more than men's after they become parents. And do we not all know this as women and men, if you're being fair about it? Have a think on this, because I dare say that I have seen situations that you go, okay, so the woman gets maternity leave, yes, but she is then forced to rush back to work. She is demoted at work. She's looked down upon. And, even as a woman, sometimes I have to challenge myself to be very, very careful how you treat women that you have employed with you or that you work with. Because the stark reality is we are judged by a very, very different standard as women. When women are of a childbearing age, they're oftentimes discriminated against just because, oh gosh, she's going to get pregnant again. She's going to have another baby again. And so even from my own personal decision making, I'll tell you that that's one of the reasons why, I didn't really have kids in my 20s and 30s, because there is this sort of pressure to have certain things in place, even professional and job wise. Like you got to wait until you've reached a certain point in your career before you feel like you can take the chance. Listen to the words carefully. Take the chance of having children, because it is an automatic detriment to your career. And so, a new study of 100, I'm going to see if I can find the study and give you guys 134 countries, labor market participation. Let me just see, labor market participation study. I'm going to see if I can find this specific one. Demonstrates that this is real. This is not something that people are making up. Okay. So very, very interesting. One final one, and then we're going to bring the governor on. She is waiting for us patiently. Thank you, madam. Another one says that the obesity pay gap is worse than previously thought. So again, and anything to marginalize people, I suppose, but studies have long shown that obese workers earn significantly less than their slimmer counterparts, yet the cost of weight discrimination may be even greater than previously thought. Wow. So yeah, pretty crazy. And I think we, again, are aware. And in so many instances, we had, I'm just going to point out Mr. Dexter's poorly placed joke last week about obese women. Obesity is the last accepted frontier of outward discrimination, right? So you can't outwardly discriminate against people of color and gender and other things without people going, oh, wait a minute, you shouldn't be saying that. You shouldn't be doing that. But obesity, I feel like it is the last allowable frontier where you can make obese jokes. You can look at people who are obese and go, oh, why don't you go and stop eating? Put down the burger, do this, do that. And everybody's kind of like, yeah. We're all on board with it. And so it's very, very interesting that those people also, when it comes to the pay gap inequity, are suffering because of their weight. Listen, I think we're all guilty of it. Look at our MPs. I mean, we're like, okay, all of them probably need to lose a good 50 pounds. And, I think if you're saying that from a good perspective about, okay, we all need to get healthier as a nation and do more towards our health, that is one thing. But fat shaming is still very much a thing. What a hot mess, y'all. Honey chill. All right. We have Governor Jane Owen joining us for the first time. Shall we give her a virtual applause? All right. Good morning, madam. How are you?
Very good. Thank you. I hope the sound on this system is working well. Can you hear me?
You sound fantastic. Loud and clear, and we can hear you.
Happy Tuesday to everybody.
Yes, thank you so much. This is your first time, and hopefully not your last time, joining us here on the Cold Hard Truth, the CMR morning show. Just in case you didn't know, it is Cayman's #1 morning show. So there are thousands of people who might be listening to you right now.
Good morning, everyone.
Yes, we're so delighted to have you. Now, our audience members, they know to be on their best behavior. Of course, you can call in. Her time is limited this morning. But if you have any questions or comments for the governor, feel free to give us a call. 93626 is the telephone number. But we want to just sort of ease into things a bit. Governor, what's the best? Can we just call you Governor Jane?
Yeah, that's right.
Yes. Tell us a little bit about what the governor does. What is it exactly that you do?
Yeah, so I guess being the governor is one of those jobs where every morning you're not quite sure what is going to come your way. There are very clear constitutional responsibilities that I lead on, and the principal ones there are security of these lovely islands and also governance structure. But as you can imagine, across everything, I need to work in close partnership with our cabinet and government and throughout the whole civil service, who are always every day in, day out, giving me and Deputy Governor Frans Manderson absolutely marvellous support. I've also been trying to get out and meeting lots of people so that I can really get under the skin, if you like, of what is going on in the island, what people are thinking, what everyone's concerns are, everyone's hopes and aspirations for the future, so that I can get a kind of short, medium and long-term view of how I can best serve.
Very good. So no 2 days are alike, and I dare say that you keep very, very busy. I feel like every event I go to, I see you there. You get invited to a lot of events.
Yeah, I've seen you at quite a lot of things, haven't I, Sandra? And it's been great actually getting out and about and meeting people. I think that is a very important part of the job, just hearing what's on people's minds. And I guess this show is another good example of the way in which we can do that.
Okay, very good. So you talk about your relationship, and I think this constitutionally, there's certain things in the Constitution that you are responsible for. So national security, policing, you work closely with the Deputy Governor, Mr. Frans Manderson, and there are actually some of your duties that you have delegated to him. That's not you personally, but the governor's office has delegated to him. So technically, you are in charge, not technically, but constitutionally, I should say, you are in charge of the civil service, but that is a duty in practical terms that the Deputy Governor actually does?
Yes, that's right. You know, work very closely on it, and of course I work with a lot of the chief officers closely. It's great, I think, that DG, Deputy Governor, is in the process of launching our kind of refreshed civil service strategy. So this is to make sure that everyone across the whole civil service, which if you include the SAGCs, the sort of arm's length bodies, is around 5,500 workers on this island. So it is an awful big chunk of the workforce, isn't it? To make sure that we're all kind of operating and going in the same direction with the same vision. And I'm really impressed with the strategy. I hope I'm not giving too much away because I'm not actually sure we've sort of formally launched it. But the good thing about it is it consolidates all of the good work that's been going on over the last 4 or 5 years, and it stresses things like accountability and cross-working. Because one of the things that has really struck me, Sandra, is that whatever issue you look at, it's hardly ever an issue of a single ministry or a single group of people. We have to get better at working across and breaking down silos.
Very good. Stephanie has a question. She says, how can she identify internal corruption within our government? Now, I don't know if Stephanie means government as in the civil service or the sort of elected political arm, but either way, any sort of even perception of corruption is never a good thing. So what role does the governor's office play in ensuring that, things are done above board?
Yeah, well, I think it's very important that people feel empowered to speak up if they have concerns. Under the Code of Conduct, civil servants have very clear rules about integrity and honesty and confidentiality and objectivity and lack of bias. And this actually also goes into areas that we're trying to address, like bullying and discrimination, etc., etc. So what I would say to people is that if you have got a concern, it's really important to raise it. I found in my rather long career that quite often concerns are at a relatively small level. I mean, sometimes they're really serious, big concerns as well. But what I have found is that very often people will say, my concern is too small to raise. I'm not going to raise it, And my advice is always, if you have got a concern, however small, the way to address it is to look at those little things, because that is how we can improve the whole system.
Absolutely. All right, very good, folks. Let's see. Miss Vicky, try refreshing your feed because everything sounds good on this end. Shaka Zula says, good morning, Governor. This is such a pleasure. Your presence and hearing from you directly is so much appreciated, ma'am. And we do have a caller in the program. Good morning, caller, and welcome to the program. Hello? So callers, just remember when you call into the program, you got to be ready to talk, which means you turn down the background sound a little bit, completely really, so that you can hear yourself through the phone. Okay, so again, feel free to call and ask your questions or any comments that you may have. Good morning, caller. Welcome to the program.
Hi, good morning.
Good morning.
Yes, good morning. Your Excellency, welcome to the program, and I'm very happy to see you here. As we saw a couple of weeks ago, we felt like we're going to lose Sandra. We were not going to have a venue where we could talk and have our questions answered or things stated. And I'm very happy to see that you're there. You're speaking to a 37-year civil servant, and I think I saw you at the meeting last week. I was the young lady holding a very distinct plaque with a young lady on it. You talked about governance. You talked about making sure that we bring, our grievances or anything, make sure that good governance is in order. You're there to make sure that the people have an outlet where they can respond and ask questions and make sure that good governance, holds on to this country. And I'm happy to hear that. This morning, I'm just calling to you as a young woman and female to female that Anna Evans has been missing for some 13 years. We have had investigation, but the kids, I don't think, have actually been told the truth. And I know that they've gotten some, kind pro bono advice and where they think they needed, and they were doing a lot of the mediation with our government. But it wouldn't hurt for our Commissioner of Police, perhaps yourself, the Deputy Governor, to just speak to those people. They're now adults, they're not children anymore, but they're still, still broken. And this case needs to be at the forefront. And the reason I'm calling is because no civil servant should be treated this way. We all come from parents that loved us, wanted to raise us the right way, do the right thing for us. And all I'm saying is we have 5 Caymanian children that are broken and comes from a civil servant. And I would like to see you, because I brought this to our former governor, Mrs. Kilpatrick, a few years back. She was kind enough to meet with me and we talked about it. She did empathize with the family, but she never met with the family. And this is something that I would like to see. I know it's falling into your lap and it's been a while, but I'd like to see you meet with this family, make them feel like they're human beings and they're not, less than human beings. I would like you to empathize with them. And I would like that your directives would be strong and straight by putting yourself in their shoes and saying, if this happens to me, or if this happens to my family member, how would I like this to be handled if I was the governor or if someone else was the governor? And I would just like to throw that on you this morning and lay that at your table, not in any kind of disrespectful way or any harmful way. All I'm saying is I just feel that these kids need to be felt, need to be heard. And I would like to see some government officials just treat that family like they are human beings. That's all I'm asking for. And I just wanted to say thank you for being there. I am a civil servant that worked really hard, even though you could hear other stories. But I am also a civil servant that created revenue for my country. two streams. I worked very close with a lot of the universities in the United Kingdom, University of London, Leicester, Wales, many of them. Many of the students are here working in this country in a professional capacity, but many of them also continued their studies. And I was the person in charge of that, of creating that venue so that they could also study while they work here in this country. Unfortunately, the last 5 years after I got hurt, I retired, and a lot of that has gone down the drain. We've lost a lot of money, and that's another story. But I just wanted you to know of some of the who you were talking to, the kind of civil servant you was talking to, someone that laid her life on the line and served her country and served it well. Thank you, Your Excellency, and thank you, Sandra.
Thank you
Have a
so
great
much.
day.
All right, my dear. Thank you so much. Really, really
Sandra, I have
appreciate
to
it.
call you back on something else, but I'll call you back later.
All right, my dear. Thank you.
Thank you.
Appreciate it. Okay. So, yeah, I'm not sure if you're familiar with that particular case.
Yeah, I remember seeing. I think it was up when I was in up in West Bay shortly after the dreadful shooting event at the Ed Bush Stadium. And first thing I'd say is thank you for your long service with the civil service. I'm, I regularly meet people from across our public service who are putting in extra hours, extra effort every day, every week. And I really take my hat off to them because I think they're often unsung heroes, if you like. And I will certainly look into the specific case. I'm very sorry to hear about the family and the upset and the trauma that has been caused. So I will certainly have a look into that.
And I'm curious. I mean, I don't know. I thought they had done the official process of declaring her dead, but I don't know if that has been shared with the family in terms of the formalities of that. But I would have thought through the inquest that would have been done. All right. People are commenting on WhatsApp saying, please be brief, folks, when you call into the program. I've had quite a few people now said, please remind your callers that the governor has limited time. So Shaka Zulu says, we read that one already. Pat says, good morning, Governor Jane. Thank you for coming to CMR, the voice of the people. I appreciate you coming to the show and would love to continue to have you on regularly, as would love to have all other members of the government, elected MPs and CMR as well. Thank you. Inspiring says, good morning. I have a question. What measures is the government taking to address environmental concerns such as climate change, conservation of marine life, and sustainable development?
Yes, thank you very much. That's a really good question. The responsibility for the environment and sustainability is very much within the hands of the government. But of course, it is something that I take a really, really close interest in. And indeed, the British government as a partner within our very deep relationship also takes a strong view of it. I think what we need to do looking forward is to make sure that we have the right balance between protecting and preserving the environment while enabling the right sort of sustainable economic development that then supports our society and supports jobs and businesses for the future. This is not a challenge that is unique to Cayman, but I do think as a small island where you look around and you can very obviously see that there is not an infinite amount of land or indeed sea or coral reef or anything else you might choose to look at. It really brings into perspective, doesn't it, just how important this work is. And I can give you my assurance that I will continue to do all I can to work through the government to make sure that we get it right.
All right, we do have a caller on the line. Good morning, caller. Welcome to the program.
Good morning, Sandy, and good morning, Governor Owen.
Morning.
My comment should last, I hope, 1 minute. First of all, let me right off the bat, I believe that in exercise of your functions, Governor, under Section 31 of the Constitution, for good governance. I believe that there's need for a commission of inquiry to look into the conduct of the judiciary, the DPP's office, as well as the Attorney General's office. You kicked off by talking about accountability and integrity and those kinds of things. When all else fails, when civil servants fail, and sometimes I dare say even when the governor fails, we go to the judiciary. And if there are problems in the judiciary, then you know that the society is finished. And very briefly, why I'm asking for this is one, recently, the Judicial and Legal Service Commission was found guilty of maladministration by the Ombudsman for failing to draw complaint rules which people could use to complain. They were found guilty. They were also found guilty just before that for deleting a record in an ongoing case. And recently, of course, there was a prosecution of a politician where it was found that regardless of what you think of the guilt or otherwise of the person, clearly there was misconduct. And this is not the first time, and I'm going to end on this. This is not the first time this has happened. That particular politician was prosecuted way back for misuse of a credit card, and emails were revealed from one of your predecessors, which said that when Makiva Bush is arrested, we shall crack open a bottle of Chablis. So there has been misuse of power right up to your office there. I think there's a need for a commission of inquiry in the judicial and legal services in the Cayman Islands. I thank you.
Thank you so much, caller. Wow. Mm-hmm.
Yeah, thank you. So I think, first of all, the most important thing is that we make sure that we've got all the objective evidence and the details in front of us. And I would note that in the case of the recent trial, we await a formal, proper, written judgment. So I will not be taking any action until I have that before me. But once I have that before me, obviously I will be considering what to do. I think with all of these, we're very lucky to have an effective ombudsman's office, and it's really crucial that we do learn from the judgments that they provide us, as indeed the judgments from other reviews or commissions. So we will continue to make sure that we are making step-by-step process. I think there was, for example, a question about how the JLSC, which is the Judicial and Legal Services Commission, how they deal with appeals and things like that. And as a result of that view, they have now put in place, they are now putting in place a process. So, we are demonstrating that we are learning from the information that is available to us.
Very, very interesting indeed. All right. Let me just get back to the questions here. Alejandro says he wants peace, world peace for everybody. Sounds wonderful. Okay, well, we're going to ask Alejandro's question. I mean, we already know the answer to this, but we're going to ask it anyway. Alejandro is saying that they need support for the cannabis decriminalization, Ms. Owen. We appreciate your support towards helping our community and abolish taboo discrimination. So what is the UK's position? Because we know this is a trickle-down effect on cannabis. There are people who want decriminalization, but then they seem to confuse it with legalization. What is the way forward for the Cayman Islands as it relates to the world of cannabis?
Well, this will be an issue for the government to take a view on. In the United Kingdom, cannabis is not decriminalized. I know this is a complex and very emotive issue. And I think whatever decisions are taken here, whether it's by the government or through a referendum, which I know has been under consideration at some stage in the future or whatever we do, I think we do need to look at the experience of others who have either decriminalized or legalized or not decriminalized. There's a whole spectrum of experience out there. And the one thing I would say is that I think we need to be very aware that the cannabis that is available now is, you can get your hands on cannabis that's very strong and very engineered. So, it's not for me to take this decision, but I would just say that we need to look very carefully at the experience in other jurisdictions.
Mm-hmm. All right, I'm being told that your time is up already. Oh my gosh, we're just getting started. Well, we will ease into things. This is your first visit. I'm sure it will not be the last. One final question that's easy to answer. Someone wants to know what book you're currently reading.
Well, I am sorry to say I never get a time to read books. So I have got this wonderful book that I dip into quite often, which is the sort of established tome, if you like, that recounts the history of Cayman. And I'm ashamed to say here that I cannot remember who wrote this book, but I have a beautiful hardback copy of it, and it is absolutely fascinating to read about the sort of 400 or 500 years, and in particular the last 100 years or so, which is very much within living memory, especially of our wonderful seniors. And just to think about the amount of change and also the amount of resilience and innovation that they have brought to these islands, which make them what they are today.
Wonderful. If we can squeeze in one more, because this is definitely an area of concern for everyone in the community. Pat says, is there a strategic plan in place to address the increase in violence in our community or our country, the safety and harmony in our communities at stake? We know that you had a press conference with the RCIPS. A lot of us are wondering, where were the other arms, like the Coast Guard, who's supposed to be protecting our shores, and others? Can I tell you that probably a good 90% of people that we polled were not impressed with what came out of that press conference? What more do you feel the governor, in conjunction with the elected officials and the police, I know the police falls directly under you, what more can be done to communicate more effectively with the public about what this policing strategy or crime prevention strategy actually is?
Yeah, exactly. Well, I can tell you that it is a really, really high priority. It's a priority for me. It's a priority for our police commissioner, in whom I have full confidence. And it is definitely a priority for the entire elected government. So what we are doing, we are trying to divide our response into three areas, if you like. There's the short term. What do we do immediately? There's the medium term, and there's the long term. Okay. So in the short term, police commissioner has been putting together a task. He's put together a task force. I hope you have seen that there's more police out there on the streets. We are making a really, really concerted effort. Resources have been shifted. So we are absolutely on the case looking at that. We have also looked in the short term at what we can do at the decision-making level. So we've had now, I think we're about to have the third meeting of the National Security Council. It usually meets once a month. We've been meeting much more regularly, and we will be putting in place a new structure, which is a sort of I hope to put in place a new cross-cutting structure to help us to join up. So lots of things going on. You mentioned the Coast Guard. I think this comes into the medium term. The Coast Guard were not there at the press conference, but of course they come under the police commissioner, so they're absolutely there. They are really there, because we're talking to them, talking to Commander Scotland, on an almost daily basis. I totally agree with a lot of the comments I've heard around the community that the problem we have is the flow, isn't it? It's the flow, it's the movement, whether it's guns, drugs, people doing bad things. We need to target that flow. And with Cabinet, I am now really looking at what more we can do on that. The long term, Sandra and colleagues, is, I think, looking at the prevention and the causes. So we are doing work on gangs or groups, criminal activity. We are doing work on safeguarding. And all of this requires us to work across a very broad spectrum, not only of the government, whether it's health and police and children and family services and education and schools, etc., but also reaching out into NGOs, non-governmental organizations in our communities. Underpinning all of this, I'm very aware we need a good relationship between the public, us as members of the public, and the police. And I think we need to make sure that there is a good flow of information. So if people have concerns about what is going on in their community, please do come forward and share those concerns, because it is only in doing that that we are going to be able to identify and ultimately prosecute the people who are causing us harm.
All right. Well, Governor Jane, thank you so much for coming on the program today. It was short but sweet. And we have an open invitation. You can come on at any time that you'd like. We love to have this level of interaction with our governors and our elected officials and everybody else who makes decisions, I think, that impact all of our lives.
Thank you very much, everybody. It's been great to talk to you and really appreciate all of your time today as well.
All right. Miss Mona says she's awesome. Was able to answer all questions clearly and effectively. Thanks, Governor. And on that note, we appreciate you so much. Thank you very much.
Thank you very much. Bye.
All right, folks, 936-2626. Phone lines are open. She's got cabinet today. I'm assuming that's why she's running. Let's take a quick commercial break and we're going to come back. And we're actually going to clarify some of the discussion from yesterday's program. So do not miss a beat. This is very, very important information.
Taste of Cayman is back with a side of black-eyed peas. Friday, April 12th. The Food and Drink Festival on April 13th. Bundle tickets and save. Don't miss out on the culinary and chef demos. Delicious food and drink from over 25 vendors. Caymanian cultural performances. Live music, mixology, and more. Taste of Cayman is presented by DART with the support of many valued sponsors. Buy your tickets at tasteofcayman.org.
Do you own a 1996 to 2016 Honda vehicle? There is an ongoing urgent safety recall regarding faulty Takata airbag inflators in Honda vehicles in the Cayman Islands. As affected vehicles get older, a combination of high temperatures and humidity can affect airbag inflators with the fault. If you're involved in a collision, the airbag can go off with too much explosive force, causing sharp metal fragments to shoot out and kill or seriously injure people in the vehicle. To check whether your vehicle is affected, go to HondaCayman.com/recalls. Honda will replace any defective airbag inflators completely free of charge. Contact the Car City service team to arrange this. Please take the time to check if your vehicle is affected by this urgent safety recall by going to HondaCayman.com/recalls now.
All right, folks, welcome back. Welcome back. Let me read a few of your comments, and then we're actually going to call Mr. Frans Manderson here, and we're also going to call Mr. McField, Mr. Steve McField, to get a little history lesson. So I need y'all to pay attention, honey chia. This person says, we all empathize with Anna and her family, but I'm also not sure what Lisa expects to be done. And they went on to say that they enjoyed the governor's visit. Okay, let's call Mr. Manderson, because I don't know if he might have to shoot into cabinet. But let's call him because he is free now.
Good morning.
Good morning, Deputy Governor Manderson. How are you?
Great. I see you had the governor on earlier, so
yes, we're getting a 2-for-1 deal today.
Yes.
2 for 1, both the governor and the deputy governor. All right. So it was interesting to have her on. This is her first time on the live show.
Absolutely.
We have done a recorded interview with her before, but I love that people can have free access and they can ask her their questions directly.
Yes.
So
I mean, I have the pleasure of working with her every day, so I think people can see that she is very warm, very friendly, very knowledgeable, genuinely cares about, our island and its people. And trust me when I tell you, she is, takes her responsibility around security, keeping us safe very seriously. We talk about it every day. She works very closely with our security services. So it is our number one priority at the moment, is to making sure that what happened on 8 Bush Plain Field doesn't ever happen again in our beloved islands. It's not Cayman. It's not what we are about as a people, and we must never tolerate something like that happening in our country. So we're working hard on it.
It was definitely a shocking incident, to be honest. So
And before you
thank you.
ask me your questions,
Yes.
before you ask me your questions, can I just say something? I heard you talking earlier about obviously honoring Women's Month, and you were talking about equal pay
Yes.
and women in business, women how they're being treated. And just to say that I am very proud to say that approximately 50% of my senior team are women. In the civil service, women are paid slightly more than men. The last time we checked, I think it was about $500 more. So we are doing everything possible to make sure that women are represented at the highest levels of our government. The Chief Justice is a woman, our Speaker was a woman, our Premier is a woman, our Governor is a woman. The Director of Hazard Management is a woman. We have a Deputy Chief Fire Officer that is a woman. We have our Auditor General is a woman. So we have women represented in very high jobs, in very unique jobs, and we make it a great effort to ensure that women are paid equally as men, and that we are not discriminating at all. So I am very proud to say what we have achieved over the many years in terms of making sure that women are represented at all levels of our government.
Wonderful to hear. Thank you for that, because of course I often say that I don't feel like we have enough information statistically around this stuff, and I'll reach out to the ESO because I'm curious, because they do a wage and labor force survey, I think, every single year. So I would like to know what additional information they have, but I'm glad that you're on top of it from the civil service perspective, because the civil service is the largest employer on the island. So it's good to hear that.
And we're going to announce today, and you can see it here, heard it first here, that we are been given the green light to increase our maternity and paternity leave. So that is going to be sent out shortly. We've been working very closely with the Minister for Gender Affairs, Miss Kathy Ebanks Wilkes, and just last week, we got a green light to begin the process of increasing it. So stay tuned. That's going to come out later today.
Wow, that's fantastic. Can you give us any indication of what the increase will be?
Well, we are. I don't have the details in front of me, but I can just say that for both men and women, we are, I think, almost doubling the amount of time that was paid, so that people can spend more time with their children. This is about supporting families, supporting that bonding time that both women and men have with their children. It is around making sure that people can take proper care of their children. So it is about, if we say that we care about our employees and their children, then these are some of the decisions that we have to make to ensure that there are, and I'm speaking as a father, the best time that I can possibly remember of spending time with my children was when they were born, and being able to take some vacation. And back then, I don't think they even had paternity leave. When my children were born, I had to take vacation. But that early time, they are supporting my wife, who needs a lot of support right after child's birth, making sure men have the opportunity to play a role in their early childhood days of their children, I think is very important. So we have made that decision. The government has agreed. The governor has signed off. So a press release is coming out later this afternoon about it.
Wonderful. Well, we have someone who's listening said the Solicitor General is a woman, the Director of Legal Aid is a woman, Clerk of the Court is a woman, and the Deputy Director of the DPP's office is a woman. I said, well, I'm waiting for the head of the DPP to actually be a woman. But anyway, maybe we'll get there.
Yes. Well,
we do have a caller. I don't know if this caller, just indulge me 1 second, Mr. Manderson. I don't know if this caller has a question for you or if they just have a general question. So I'll allow them to jump in.
I think we're talking about visas, right?
Yeah, we're going to get to that. So caller, did you have a question for Mr. Manderson, or was this just a general question or comment?
Very quick question for Mr. Manderson.
Okay.
Is that change to the maternity law for the Labor Act or the whatever the public.
So in other words, is it just civil servants?
So at the moment, it is just for the civil service, but we are very hopeful. Just give us some time. Give us some time. So let us start. Let us start, and we are very hopeful. We have a minister. Again, Minister Seymour is working very closely with us around it, because obviously he is responsible for labor. So I would expect that once we have rolled out our new program, give it some time, let's see how it's working. I know he is keenly interested then in engaging with the private sector to see what can be done on that side. So stay tuned. But it is all in the works.
Sorry.
Yes.
I'm just pointing out that there's not even paternity leave in the Labor Act yet.
Yes, agreed.
So we really need to get with the times. Thank you so much. That's it.
Thank
Have
you.
a great day.
Yes, thank you so much. So that definitely exciting news for, I think, everyone who is who's listening to the program. Wow, fantastic. All right. Well, the real reason I'm glad you gave us that little nugget, and you also shared with us the strive to have equality in the labor force with our mothers and aunts and grandmothers. Sometimes women are working way past 50 and 60 years of age now. It's good to hear that the civil service is trying to lead the way in terms of that. It is there's so much around sort of pay gap and equality that we could be discussing, but we're going to sort of put that on the back burner for another day. Yesterday, we were having a bit of a discussion about the visas. And I know that you and I have spoken sort of privately about this. There's been a lot of chatter in the community about Caymanians having had visas turned down in recent times for different things. There's one scenario where someone had gone to Cuba, for example. They had their ESTA revoked, and then they were told to apply for the visa. And then when they applied for the visa, and this is a professional attorney, no history of any concerns or anything. When they applied for the visa, they actually had their visa application turned down. And so there are concerns, there are concerns around that. We've heard of an MP having issues with his visa potentially being revoked or some sort of problem there. Students are saying, listen, parents of students are saying the U.S. has just issued this travel advisory for their citizens. Why are we sending our kids to Jamaica if there is an uptick in crime to get a student visa? Some situations, the parents aren't able to travel with them, and they feel very, very uncomfortable having their children travel alone. So are we any step closer? I know you've said that, we've asked the question before, but are we any step closer to getting any sort of
consulate? We've asked it again, and we have been, Her Excellency has been using her office. I have been using my office to engage with the Americans. We really are not sure what has changed, because some of the things that you are talking about, we have never experienced before. Caymanians were giving sort of preferential treatment on timing. If we applied for a visa for appointment, we normally got an expedited appointment. And it was normally a very seamless procedure. But now it seems that for some reason, and we don't know why, we've asked the questions, things seems to have changed a bit. People that would not normally have been refused have been refused. People have been revoked. We understand about the ESTA situation with people that have been to Cuba. But of course, we have had some of our civil servants traveling on official business to Cuba and experiencing problems. So we've had to make those representations. Obviously, they can't be helped if they were, they shouldn't be punished if they were sent to Cuba, for example, on a repatriation flight. They had to go. So we've encountered some problems. We've been able to work through most of them. But I can just want to assure everyone, this is something the government is aware of. We are making representations to the embassy to try to, start the dialogue to find out exactly what is the issues. Is there something that we need to address? So we're on it, and things are happening on a daily basis in terms of the interactions. I think we're making some progress, But I think there's still more work to be done for us to actually get to understand why we are experiencing some of the problems that we are.
All right, we do have another caller on the line. Good morning, caller. Welcome to the program.
Good morning. I have one question for Mr. Manderson.
Good morning.
Good morning. Mr. Manderson, I would just like to ask you a quick question, Deputy Governor.
Sure.
I'm a former civil servant who was a immigration officer, and regrettably, her daughter has been in the United States now for 6 months, and it's been the last 2 years. She developed an autoimmune disease, and unfortunately, this young lady time expired the 1st of March. And we called the U.S. Embassy. We went to the airport. I flew up on January because my friend, the mother, she's diabetic. She retired last year. And because in 2018, she actually fell at immigration. And she had some problems with her eyes. She had several surgeries at Baskin Palmer. I was with her throughout the whole journey. And basically, I'm calling to ask, where should our Caymanians, or is there something set up through your office or a passport office? When our Caymanians are overseas and they are faced with being hospitalized for 6 months or longer, do you have, or do our government have any type of office that we can go to? Because we had a very difficult time trying to get this time extended. However, I did speak to a young man that was at the hotel, and he said to me, "We have an office on 57. Why don't you try there?" So, of course, it's off 36th Street, Northwest 36th Street. It's right in line with the airport. And we went down there to a very small office, and they were kind enough, and that is where they do extensions. Now, you may be aware of it, I'm not sure, but I am just calling to find out, do we have another office? Do we have anything in place for anyone, from any of our citizens that are going to be there for a long period of time to basically help them? Because when I called the British Embassy, they told me I had to pay $69, and it just kept going on and on and on, and nothing they were saying was there to help me to go from step A or step B, what I could do to help my friend and her daughter who's hospitalized.
Yeah. So thank you for the question. So the short answer is, normally I would say if you are in a foreign country and you are get yourself into issues, the place for you to reach out to is the British Embassy. If they are not providing assistance, then by all means, yes, contact my office, and we will try to help. We have the governor's office here who always willing to help with any issues that arise. But the most important thing that we as Caymanians need to do is to understand the rules. So if you go in on an ESTA, for example, I think the maximum period of time you can stay is 3 months. Yeah, I think it's 3 months. But if you go in on a waiver, then you can stay for 6 months. So it is very important that I think our people educate themselves about these issues. Sometimes it's an emergency, so you just have to just fly up, and as the caller said, rely on your family and friends to help you. But first thing we should do is educate ourselves about, if I'm going to have to be flown off, what are the things that I need to do proactively to make sure that I don't get myself in problems? Because as the caller said, we have had these issues before where people have gone off for extended treatments and then find out at the very end that they have overstayed in the country. And then we have had to then try to help get the person to Kingston to apply for a visa. Of course, if you're very sick, that is something you don't want to have to do. So being proactive is very important. Understanding the rules is very important. And absolutely, we'll be here to try to help in any way that we can.
Okay, caller, thank you very much.
No. Hold on one second. Wait a second, Sandra. So I just wanted to share with you, Mr. Manderson, the office on the 57th Avenue is called General Aviation Facility. It's 3550 Northwest 57th Avenue. And they're open from 8 to 11. And they do walk-ins all the time. And they do extend for a month on a month basis. But then, of course, they also have a form online if it's going to be a period where, like in my friend's case, I don't know how long her daughter may be overseas. She's already been there for 6 months. And she's in the trauma unit, which it's not something that she's going to come home from tomorrow. So we don't know how long she's going to be there. We also had to go online, fill out the form, pay nearly $1,000 for these 2 other forms that had to be filled out and was sent to the headquarters. But this is information that I'd be glad to share with you, that if a Caymanian needs to get right there near the airport, right there on off of 36th Street and 57th Avenue, they can go to this facility and they can definitely get an extension, sir.
Okay, thank you very much.
That's very good information. Thank you.
All right, we do have some other callers. Let me just grab this one. I see they're calling on WhatsApp overseas. Good morning, caller. Welcome to the program.
Hi, good morning.
Good morning, ma'am.
Yes, I'd like to speak to Mr. Manisel. I want him to listen to this for me.
Okay.
Yes, I want to say I have a great grandson in the Cayman Islands. And because the 2 parents are separated from marriage, they need to put legal rights that both the mother and the father also have legal rights. I take my money and send to renew my great-grandson passport. And I want him to come up here to look for me because I can't go for the summer. And the mother is fighting because I made my grandson hold that passport. I paid for it. Both of them have legal rights, supposed to have legal rights to the child. And I think the mother is using it against me, that I cannot get my grandson to come and spend holiday with me. And she demands the passport from my grandson. I'm the one sent to renew the passport and I'm the one paid for it. Both of them are 2 parents. They need to speak to one another so they have a good communication. I'm the one. My grandson don't shorter clothes, he don't shorter shoes. Back to school, I'm responsible for it. My great-grandson. And I need Mr. Mandis to look into this because I'm suffering. It's my little great-grandson. And I want him to come up here because my grandson have the passport that I sent to renew. The wife is fighting about it.
Okay, so how old is the grandson?
He was 8 yesterday. He was 8 on his birthday was Saturday.
Yeah, so
and
obviously
I
an
sent for him to
8-year-old.
the birthday party Sunday.
Yeah, so obviously an 8-year-old can't travel by himself, and he would need parental permission and some sort of escort.
Him. I have someone for him to travel with.
Yeah. So, France, I don't know if this really falls under your remit per se, but this is a question of parental rights versus grandparent visitation rights.
My grandson is an idiot because I tell him to go and teach his rights, and he just sit down there like a fool. So the passport is his responsibility because I tell him to keep that passport. I'm the one who pays to renew it.
All right, my dear. Thank you so much. Any advice for that grandmother?
Truthfully, I'm not sure what was the question. What exactly her grandson is not able to have?
So she wants the grandson. She said she sent for the grandson's passport. I guess she's paid for the passport because maybe he didn't have one, and she wants him to be able to visit her. And she's saying her son, I think the son is her son, is an idiot. So I mean, it's a family mix-up story, that's for sure. So I don't know how much.
Maybe she can contact me offline or send me an email or something that I can assist. But I'm not following exactly what she's saying.
Yeah, I think she just wants her grandson to visit her, and she's wondering if there's some way that the parents can be compelled to make that happen. Grandparents obviously don't have the same rights as parents. That's just the luck of the draw.
yeah, I don't think we can compel
Yes.
people to make their children travel. Yes.
Oh my gosh. I'm told to have a look at your WhatsApp messages. And then we have another caller on the line while you're doing that. Good morning, caller. Welcome to the program.
Well, good morning again, Sandra. I mean, this is a great privilege on your it's a great privilege on the same morning to call both the governor and the deputy governor.
I know.
Yeah. Now, my two comments only. Both relate a little bit to a response to the governor, but also they relate directly to the deputy governor. Deputy governor, I did mention in my call to the governor that actually that there was a finding by the ombudsman recently that a record was deleted in the judiciary relating to an ongoing matter, and the ombudsman found the judicial administration guilty of doing that. Now, as you know, under the National Archives and the Public Records Law and the FOI law and other laws, I'm sure, it is a criminal offense to deliberately delete a government record. And I want to find out from you, I know you might not have the answer immediately, whether the people who actually deleted that record are going to be prosecuted under those laws. You yourself did indicate in a circular you issued some years back that FOI is totally useless if we can't have proper record keeping. That's the first point. The second and last point relates to what the governor responded to. He said, well, look, the Judicial and Legal Service Commission has now learned and that they have now issued the rules for complaint procedures against judges. Now, I think that it is important that I respond to that because a lot of people have been calling me about this because of the certain complaints they wanted to lodge. What the governor said, the ombudsman said, and I'll read it, it's only about 5 lines. She said, quote, I found that maladministration occurred due to the failure of the commission to update its complaints policy for judges to bring it in line with the Cayman Islands Constitution. Given that the commission appears at the very least not to have acted with any urgency in complying with its constitutional responsibility to draft a complaints policy, I found that this extraordinary delay of some 7 years amounts to maladministration, unquote. And in closing, Sandra, the reason she wrote it like that was because at the end of 5 years, I raised this with Governor Roper. I said, these people have not done this for 5 years. And they admitted at the time, they said, yes, we haven't done it. We are sorry. We are going to do it. And then 2 years later, this is now when I engaged the ombudsman. You know what they said? They said, well, it is not by any means necessary that actually we should draw these rules. So what is significant about that is both the delay, the failure to act with urgency, and then eventually when they are found guilty of maladministration, they say, well, we didn't have to do it anyway. That's why she was so mad with them, and she found them guilty of maladministration. And in closing, the date on which she wrote the letter to me to say that she had found them guilty of maladministration is the same date they rushed to put the rules on the website. This should not be happening. I think, Deputy Governor, this shows a lack of desire to comply with the rules. I thought I should make that clear.
Thank you very much. I appreciate it. Right.
So thank you, Paula.
So, wow. Looks like you need to come on the show more often, Deputy Governor.
Yeah. I too have cabinet, so I need to get ready for that. But I want people to understand that we are aware of this visa issue. We are doing everything we can to rectify the matter, but it's not telling the U.S. government to change something is not an easy task. They just like how people want Cayman to protect its borders, they are saying, well, I have a right to protect my borders as well. So this is something that is around, I think, education for them to come to Cayman and see that the standard of living that we have here. So we're trying to engage and to make sure that our citizens don't have this problem going forward. But it's not easy. We've invited them to open an embassy here. We've invited them to come here from time to time to issue student visas for some of the same reasons that you outlined before. so far we've been unsuccessful, but we are not going to give up.
Mm-hmm. All right. Thank you very much, sir. We appreciate it.
Thank you.
Okay.
Thanks to everyone who called in.
All right. Again, folks, that's Deputy Governor France Manderson giving us a half an hour of his time this morning. We appreciate the time. Thank you so much.
Thank you.
All right. So we're not done. We're not done, folks. We're bringing it to you this morning. Lots of educational calls. So let's get Mr. McField on the line. So he's going to educate us on the waiver visa system and kind of how all of that got started for the Cayman Islands and why we have been so incredibly fortunate. I tell y'all what, classes in session this morning. Don't y'all be falling asleep. We start out with the sleep segment. Then we had the governor. Now we have the deputy governor. And here we are now. History lesson, hopefully, coming right up. So I'm calling him on WhatsApp. I might have to do a straight line call. Let's see. Yes, because I'm aware that sometimes people are not in the zone for WhatsApp calls. So let me give him a straight line call. Y'all hold on 1 second, honey chill. Mm-hmm. Let me end this one over here. There we go. Okay. Everybody awake? Good morning, Perla. Pat says CMR, the #1 show in the land.
Hello.
Good morning, Mr. McField. How are you?
Okay. How are you doing?
I'm good. This is Sandra over here at the Cold Hard Truth.
Yes.
We love to pick your brain because I tell you what, you're almost 90 years old, but I know you got a better brain than most of us, half your age. So we had a question or a comment that came up yesterday about how Cayman got so fortunate to be able to be eligible for this waiver, to be able to get waivers, to be able to travel in and out of the U.S. a lot easier. And one caller said that it took the testicular fortitude of Mr. Jim Bodden to get it done because apparently he went and met with Jimmy Carter. Now, I thought that sounded a bit, I'm like, I've never heard of that before. And you don't just get an audience with the president of the United States. Let's be very, very clear. Our politicians really aren't anyone when it comes to the president of the United States. So have you ever heard of this story of Jim Bodden meeting with the president of the United States, and that is how we got our waiver program?
Well, number one, the waiver system was in place long before Jimmy Carter became president.
Oh.
Jimmy Carter was probably still a peanut farmer when the waiver system came into effect.
Okay.
The waiver system came into effect, I would say, between 1948 and 1950. That's when the waiver system came into effect. Mr. Orman Pardon was first elected to the legislature, to the vestry in 1948. And then one of the other members in the vestry were Captain Keith Tibbetts from Cayman Brock. And the waiver system came in primarily because of the honesty of Caymanians. Their honest, their great honesty, their truthfulness, and their honesty. They never ran away when they went to America. They were very honest, and they were hardworking people. And the immigration people and the custom people in America knew this. So, when National Bulk started to take people to work on their ships around the 1940s, 1950s in mass, at first, Caymanians were going to America to find jobs on the Swanee ships, the banana boat ships that going from Nicaragua, Honduras, and all those places. They call it Swanee Line. They never had a visa. So to combat, to overcome the fact that they never had a visa to go to the States because they didn't have the money to go up to the Jamaica embassy or to go to some other embassy and get the visa and then come back and then go to America. So what they did, they usually went to America on the ships, the RDH, the Antares, all of those, the Morocco and all those, and they signed on as crew. Now they had to pay the passage. I think the passage was £8 or something like that, £7.10 or £8. They signed on as crew. And in those days, when you sign on as a crew and you got off the ships, the immigration and custom would give you 29 days in America. After 29 days, you had to leave if you didn't get another ship. If you didn't get another job on another ship. The Caymanians would sign on to the ship, would pay the passage, but it would be crew. And the immigration knew this in America, that's how they were beating the system. And they didn't say anything about it because it was an ingenious way. And they turned their backs on that. And then national bulk carriers started to call and say, listen, we need 30 men. We need 25 men. We need 40 men. And in those days, national bulk carriers used to get hired LACSA to take the men away from here. So you got to call this up. You got to call. Miss Gwen called you this morning and say the cable came in. Your name is on the cable. 35 people are going to Japan to bring a ship from Japan off the shipyard. 35 people, and you have to LACSA's coming tomorrow evening to take you on to Miami and onto your destination to California, or where you're going to Japan. You didn't have time to go to the embassy in Jamaica to get a visa. I mean, that was impossible. And so when you got the call, you would go right away, get this, I think it was a shilling stamp or whatever it was they had to pay. Make sure you pay your taxes because you hate tax, because you wouldn't leave until you have to pay that tax in those days. And you went and you took the stamp to Bibo, Mr. Ernest Pandon's daughter, who was a passport officer, and she would have your passport in an hour. And then you went up to the hospital. You did the physical, Miss Morty. Same old test your urine, that was okay. You passed your physical. And then your family some people never had shoes, never wore shoes. Your family would rake up the money and buy you clothes for you. I remember when I was first going, my grandmother was giving me towels to go, and I say, "Ma, they have towels in the hotel." She said, "No, you carry your own." So then next evening, everybody came to the airport. LACSA came in to see you off. You were off. 25, 30 men were off. How do you think they got into America with no visa? So in order to facilitate this, Mr. Panton, O.L. Panton, and Captain Keith Tibbetts went off to America. First, they went to the embassy in Jamaica, and the embassy directed them to go to the United States, to Washington, D.C. with the State Department. And they went there, and they organized, and they laid the case out that this was impossible for us, but our men needed the jobs. And because of our honesty, because of our genuineness, because they knew that we were honest people, that when we went to America, we didn't run away and hide and so forth. They gave us something called a visa waiver, a piece of paper from the governor, from the commissioner's office, to say, this will waive you through the Immigration and Customs Service in America. That was primarily to get the seamen from one place to the next through America. And then, of course, that extended to anyone who was Caymanian, as long as you had to get a police clearance, as long as you didn't have a police record, you would get the waiver visa and you could go to America. That is how the visa started. It had nothing to do with Jim Borden, and it had nothing to do with Carter. Carter was not even president at the time the visa waiver system came in. Carter was probably still a peanut farmer.
Oh, wow. Okay.
You see?
Yes, sir.
And it was because of the Caymanian people's honesty. And so many people come now. They get their permanent residence. They get their naturalization to be British Overseas Territory citizen. They come Caymanian and they get the waiver. They go to the States and the waiver allows you to stay at least 6 months. Now the waiver is a one-way waiver through. You cannot, like go take the waiver and say go to Atlanta or go to New York and then go and then leave and go to Canada or some other place and come back on the waiver. That's not how it works. It's only to waive you through on the first entry. And some of these people, they come and they can get the waiver, something that they will never dream about in their own country. And they don't know how. And they don't know how it happened, and they don't really care. And they really don't care.
So
and
is it true then that Cayman is the only place that had been given
we're
this?
the only place that have that. We're the only place that have that system, because most people come from South America, Argentina, Brazil. If they're going to England or something, they have to stop in America. They have to get what they call an in-transit visa.
Right. Oh wow.
We're the only place. We're the only place that has that. That your government, your passport office, your commissioner, your governor can give you a piece of paper to send you to America, and you don't have to have a visa. That's a privilege. That's a privilege that Caymanians own, but their honesty, their genuineness, and so forth.
All right, we do have a call in the line. Caller, do you have a question or comment for Mr. McField?
Yes. This is, I called yesterday with the same comment about President Carter. I never said that President Carter developed the waiver program. I said it was developed, I believe, because of seamen. But what I was talking about is that when Mr. Jim was in, he had an employee that got turned down from her B2 visa. And a relative told me that they believe that he went to see, he was upset about it because he wanted this person to work strongly for Cayman Airways and represent the country. And Jim Borden pulls up his socks and he met with a very senior, either the president or a very senior member, asking why this was so, because we had a treaty with the U.S. government and that this person did not come to do any harm in the United States, basically just a B1 or B2 visit to visit. Therefore, the visa went after that meeting. It resulted in the young woman getting her visa. If you listen to what I said yesterday, I believe that most of this happens because seamen could go overseas. And also, I think we were the only country in the Caribbean country. I didn't say Jim Borden developed the visa.
No. You said that he went and met with.
To make sure that we got.
I'll definitely go back and listen to it. But I'm sure you said that Jim Borden went and met with Jimmy Carter.
Yes, that's what I was told.
So now we know that never happened for sure.
Went to visit with him, but if it wasn't him, it was definitely a senior member, because I'm talking to someone that is very old. So they know that he went and met with a U.S. representative who then made sure that the young person that was working for Kyle at the time under Mr. Jim got that B2 visa, because they said it was wrong because we had a treaty. That's what I'm saying. So let's get it all. Let's get it straight.
Well, the visa waiver was enforced long before Jimmy Carter became president.
Exactly.
But what Mr. Jim did do when Mr. Jim got rid of LAXA and started Cayman Airways, and it was difficult in those days. I was in the government then. Mr. Jim wanted to regulate the flights, American Airlines, not American Airlines, American Airplanes. So I would say, because if I say American Airlines, if people say it was American Airlines, because all American planes come in here to regulate how many times they could come in to give Cayman Airways a berth to make Cayman Airways work. So that Cayman Airways was a carrier that could service the country. He wanted to limit the flights that all those American planes coming into Cayman. So Mr. Jim got a delegation of people and went up to see the FAA, the Federal Aviation Services, to get a moratorium to stop Northwest and all them coming in so many flights a week, so Cayman Airways could get those passengers. Mr. Jim went up there, and Mr. Jim had meetings with these people up in the FAA department. And when they listened to Mr. Jim's request, the guy said, "Oh man," he said, "Mr. Jam," he says, "you want American airplanes to stop and come to your country?" He says, "Mr. Jam," he says, "I got the data here. You flew into Miami so many times last month, and you flew into Houston, Texas, and you flew into Tampa." He says, we can't give you a moratorium to stop American airplanes from flying to your country." He says they have a right to fly where they want to fly, and turned Mr. Jim down. Mr. Jim's delegation was in Washington, D.C., and Mr. Jim then told the delegation, "Guys, I'll stay in a hotel here for a few days," and Mr. Jim took off and didn't tell anyone where he was going. Mr. Jim went off for a few days. He was probably gone for 3 or 4 days. And then Mr. Jim came back. And then Mr. Jim told Gilbert McLean, who was Mr. Jim's permanent secretary, "Gilbert, call those people and ask them we can have a meeting again with them." So Gilbert got on the phone and called those people and tried to get them in. They could say, "Well, we made a couple of days ago, we had a meeting with us and we made we gave you our decision." So Jim insisted. "Well," he says, "you can come back, but it says my decision's the same." That was the head of the FAA, whatever it was. And Mr. Jim went there, and Mr. Jim pulled out an envelope from his jacket and threw it on the table and said, "Read this." And when they opened it, it was a letter from the Justice Department, from the State Department, giving a moratorium for 4 years so that Cayman Airways could exist, could develop and exist. You know where Mr. Jim went? Mr. Jim went to Texas and met Governor Conley. Remember, Jim? You know how that relationship happened? You remember those Ahajika and all of those people who were Texan, who were here investing, the first investors who came on the island that were from Mr. Jim that built some of those apartments on 7 Mile Beach and stuff? Governor Conley was a friend of Mr. Jim. When Governor Conley came down, and it was a Saturday night. Saturday they went fishing, and they came in late. And they, by the time they got back at Holiday Inn and cleaned up and stuff and had their dinner and went down to the wreck of the 10 Sales bar where the Barefoot Man was playing, the bar was closing. Now, Andy Martin, the Cayman Cowboy, was one of the bartenders there. And Jim went up to the bar and told them, says, "My guests here." And they said, "Mr. Jim, we're closing now. We're closing. We can't serve you any drinks." And say the bar is closing. He says, "You are a member you are the chairman of the liquor license board, and you should know that if we serve drinks here, that we would be committing an offense." And Jim says, "Son, take a license off the wall and bring it here to me." He said, "What you mean?" He said, "Take a license off the wall, the liquor license off the wall, and bring it to me." And the Martin took the liquor license off the wall, gave it to Mr. Jim. Jim opened it, take out the glass, and Jim wrote on it, "I hereby certify that this liquor license number so and so and so to remain open, blah blah blah, until 5 a.m. in the morning." Signed, J.M. Borden, Chairman's Liquor License Board, and said, "Put this back on the wall now, son, and serve the drinks." When everybody heard what had happened, they all rushed back down. The bar opened till 5 o'clock that morning. So they were all drinking in the bar. When they went back to their rooms, and they got ready for the flight the next day, going to Houston, Texas on Cayman Airways. The Hamilton who died was the captain. When they got to the airport, Governor Conley and his crew, they got to the airport. Cayman Airways had waited for them, but they had woken up late, and the flight was gone. And Jim went up to the tower and says, "What happened here? I told you to hold the plane back." And they said, "Mr. Jim, we held the plane back, but we couldn't hold the plane back any longer." And Mr. Jim said, "Well, where the plane is now?" He said, "The plane is past Cuba now, entering into the American airspace." And he says, "Tell her to turn back and come back." And say, "Mr. Jim, you can't do that." Jim took the mic, got onto the mic, and told the captain, "You turn that son of a bitch round, and you come back here and pick up."
Just remember, we're in the radio, so certain languages we can't have on mobile.
Well, Jim said, "You turn that SOB round, and you come back here and you pick up my guest, because if you don't do that, when you reach Houston, I will have your replacement." The plane Cayman Airways turned around, pick up Governor Conley, and took him back to Texas, and that forged that friendship. Jim went to Conley in Texas. Conley called his friends over in the State Department, explained the situation, and Jim got the moratorium for Cayman Airways. That's what kind of stuff Jim could do. But the visa waiver was in place long before Jim came into power. Jim didn't get into power until 1972. Jim first got elected in April 1972, when after Hunter's father died, Clifton Hunter died in a by-election, and they wouldn't seat him in the legislature because they say he was an American citizen. I mean, you should see that whole file. That is something else. What they did to him, and even the method in which they took him to court to stop him from sitting in the legislature was wrong. The method was wrong, and they refused to sit Jim in April when Hunter died, and then Jim ran in the election again that November. And Jim got elected, and then that's when Jim got seated in the Legislative Assembly.
Lots of history. Thank you so much. And just one point of clarification, someone who's listened to the program sent me a list of the visa waiver program or countries, and there's actually 41 countries that are participating in the visa waiver program, and it's a long list of them. But we might have been the first, but we certainly have not been the last. But appreciate you so much for sharing this information with us. Really, always appreciate your wealth of knowledge.
So what I suggest you should do is try to use at least half an hour or 45 minutes of your program at least once a week to sort of enlighten people about their history.
Absolutely.
People don't know where they come from. They don't know where they how they got to this place, and don't know where they're going to.
Yeah,
and that's a problem. That's a problem and you can hear if you know me, you can hear by my voice, by how I emphasize on things and what I'm saying, that the history of my country is very important to me. It is sort of my background. It is my foundation in which I walk every day.
Yes. Somebody just commented, they said you need to do a Cayman Voices segment with him. I don't know I think we have talked about this actually for a couple of years now, but we do this series called Cayman Voices, and we've done a lot of wonderful people, Miss Elrita, and tons of others I can't even think of right now. But you're on my list. So anytime you're ready, let me know. We can sit down and have whatever amount of time you're willing to give me, half an hour, and we can really talk about anything you want. If you just want to talk about Cayman history and politics and so on, we're happy to have you. So,
well, what interests me right now is the consequence of slavery, the aftermath of slavery, the things that are raising our heads now that came out of the fact that we were once in bondage for over a century, and we have done nothing. We have done nothing to sort of rectify that damage, that psychological and sociological damage that happened to a lot of people, and we haven't done anything. But other people have done it by that and stuff, but we have not done anything about it, and as a result, some of the things that happen to us now is because of our behavior is because of some of the things that happen to us that we have not tried to rectify. And it's would be very interesting. I'm not a sociologist. I studied sociology as one of, as you know, when you go to university, you have courses that you can take. But I am not a sociologist. student, but I studied sociology. I studied from a lot of the sociologists, and it would be very interesting to have a study here to see why some things happen to us, like for instance the work ethics. Because after emancipation, they had to bring a contingent of the West Indian Regiment here to keep the peace between the people who had gotten their freedom and the people who had them in slavery, and that caused a lot of rift here. And T. Ernst has a book called The Lawless Caymanians. He writes that, and that is very, very interesting. And as a result of that, a lot of people, they had the great exodus between 1940s and 1840 and 1850, where a lot of people who rather work didn't want to work. Well, that's the reason why Cayman, in the Caribbean, Cayman was the first person that got full emancipation, because emancipation was the 1st of August 1834, and then you had to work 4 or 5 years as an apprentice for little money, and Caymanians refused to work, and the governor had to come back down again, brought a contingent of soldiers to keep the Caymanians and the slave masters away from fighting each other. And then it got so bad that in May 1885, they emancipated Caymanians, apprentice slaves all together. They didn't have to work as an apprentices and so forth. And they refused to serve them. They refused to work as servants. And some of them went to the Bay Islands, they went to Honduras, Nicaragua, and all those places. They call it the Great Exodus, where half the population left. And today, a lot of Caymanians don't want to serve, like in the hotels, and don't want to serve as servants in people's kitchen and clean houses and stuff. And it's very interesting when you look back and you see why that is. It comes out of that one century of bondage. Caymanians don't want to do those things. And I tell a lot of people that you have to study that. That's why Caymanians are not resume people. I mean, they're not going to line up to go and get any jobs in anywhere, things like that. Whenever there was work, they would call you and say, "Oh, your boy home, Miss Mabel or Miss Alma, your boy home? I'm building a house and I need a few people," and they would send them over there. But they're not going to line up to get no job like other countries where you line up all day outside the gate and wait till you get a job. That's not happening to Caymanian people. And Caymanian people don't like people to boss over them and to be servants to people and to talk down to them and stuff. They're walking off the job and go home. It doesn't matter the consequences. All of those things as a result of what and one thing why I'm so interested in of education is because I am so proud. Because when they sent the first school teacher here to teach the school after emancipation in Bordentown, and the teacher was teaching the black and white children together, the slave master said, no, you can't do that. And he said, well, I'll build a ladder, put a loft up in the building, and I'll put the black children up there and go and teach them and come down and teach them. And he said, no, they have to pay £6 a week. Well, they didn't have any money. It was slave masters that got the money.
Yes.
They got all the money. They got the compensation. But the people who worked for a century didn't get a penny. And so a petition was taken up in Bordentown. Your family probably too. Your family too were probably part of that. But a petition was taken up by the free people in Bordentown, and my great uncles were some of the signatories of that petition, saying, listen, we need to get an education here. You send the man back to Bordentown to teach us because he was a good man, and we don't understand why the slave master doesn't want him to continue to teach us. That's why, and so forth. And my great grandmother was my great grandmother was a Solomon too. Yeah.
Wow.
Yeah.
Let me read a few comments. I see Lisa, is that you back on the line again? You had another question or comment?
not for Mr. Matfield. I have something else to talk about.
Oh, okay. We're running out of time, but let me read a few comments. Perla was asking about the process for visa. Perla, that's the whole point of calling Mr. Manderson earlier. So if you rewind, you'll probably get an opportunity to hear the answer. Inspiring says your show today is incredibly educational and important. Inspiring goes on to say the depth of information you're providing is truly enriching, and the topics you're covering are so relevant to understanding the world around us. Keep up the fantastic work. Thank you very, very much. Cameron says, don't get the good old doc all riled up this morning. Giving us some good history.
Well, yeah, people call me Sandra Lockton to say, well, why am I not writing a book? Well,
I was just going to ask you that question because we have someone asking.
Roy Borden has 3 or 4 books. None of them are in the schools.
Oh my
None
gosh.
of them are in the university. So why should I write a book? Caymanians don't read no history.
Oh Lord,
Shoshana
says, can you ask Mr. Macfield if he's written a book by himself on the history of the Cayman Islands or purchase? Well, he's answered that question for you. Live Happy says, wow, what a fantastic piece of Caymanian history. Mr. Richard Parsons said, great history lesson. In fact, we referred to it as the waiver instead of the visa. Cameron says, we real Caymanians are still some of the most loyal and honest people walking the face of the earth. And Richard says it was unique and very special. Alejandro, thanks you for clarifying. He says, thanks for clarifying with us, Dr. Steve. Cameron says, too many people abusing the system. Our generation sacrificed to create, and now we're bearing the crosses of those users. Sad situation. Mr.
So Sandra,
Paul, yes.
So Sandra, I have a publisher. I have been speaking to him now for several years. And when he read, I have a manuscript. When he read it, he said to me, if you publish that, they will hang you, probably hang you.
Oh
remember one time, I was persona non grata coming back here. Do you know that?
No, I tell you, this is why we need to sit down and do that interview, because there's so much that I'll admit that I just don't know.
Well,
yes.
I wrote a letter to the UN back in the 60s, and I was asking them for internal self, because I was a disciple of Mr. Ormond. I was supporting him for internal self-government, and they took my letter in the UN and they turned it into a petition from an individual, and they circulated through the United Nations, and the administrating country, the Great Britain, was upset about what I had done, and they told me that I would never be welcome back here. A lot of people don't know why I had such trouble coming back here and trying to get resettled. They don't know anything about me. They talk a lot of crap about me, but they don't know anything about my history. I went through all of that, and I have a manuscript. It's called Fantasy Island. When you read it, and my publisher says they will probably hang you because I call names and places and things, and Roy Borden just writes the wrong things. I say things directly. Who's responsible? Who are the rakers and shakers of our history? Who made the decisions for this to happen and for this not to happen?
Well, let me read you a few more comments. We're about to wrap up on radio, but these are some very, very interesting comments. So this person says some good history books are needed by the real Caymanians. Enlightenment and knowledge is well needed. Live Happy says his Caymanian Voices segment would turn into a 5-hour movie. He knows a lot. Well, we will do it for as long as people can talk. So if he wants to do 30 minutes, 1 hour. Denward Ebank says, wow, this is the historical accounting that catches me to the core. Thanks and good morning. Lavana says, I could listen to Mr. Macfield all day. He has so much knowledge and history. Johan says, great stories, but I do not want that sort of governance or behavior from our leader, elected or non-elected persons in 2024 from my island. Yeah, I mean, the things that Mr. Jim might have done way back when, you can no longer do. That's for sure. Cameron?
I'm not justifying what Mr. Jim did. I never justify what Mr. Jim did. I'm saying what happened.
Yes.
Those are the things those are the facts.
Yeah. Cameron says, love them stories. You see, Mr. Jim was like no other. Sharon says, love listening to Mr. Steve. So much knowledge. Live Happy again says, wow, what a fantastic piece of Caymanian history. So lots of people always enjoy Mr. Steve, you coming on the program and sharing your wealth of knowledge. Damon goes on to say, this man is a wealth of knowledge. He needs to make as many voice archives and interviews as possible. Now, I know you're pushing 90 and you're still feeling good, but you know, my dear cousin, one of my objectives with Cayman Voices is indeed for us to record these for the purposes of listening now, but to also archive them for future use. I mean, one day I hope the archives will contact me and say, hey, the Cayman Islands government hasn't been able to do it. CMR is doing it. We don't care who does it. Let's get these recorded interviews into the archives. But you know what they say about a man in his own country? He's often not appreciated until after he's dead.
I know that, Sandra. I know that. I know that, Sandra. I know that. Yeah. I know that very well. And if people want to have experience, want to know that, they can ask me. I know that very well. Mm-hmm. I do know that very well.
But I think the overarching, you know, I put aside my own personal feelings because I think the overarching benefit to our community of hearing these stories of, you know, somebody who was there and who got it at least firsthand from people who were there, I think is incredibly important. And it's one of the ways that technology can help us to preserve our own history. So Christopher says, good morning, Sandy. I really like to hear this about our Cayman history. I don't even know the things Mr. Steve was saying. Wow. So, you know, a lot of our people just don't know. Mr. McFeel has a head on him for his age. What he is saying about Papa Jim, Mr. Jim Bodden, is so true. So yeah, I mean, I think a lot of people appreciate your knowledge, and we're here. Anytime you're ready, you just call me and I hit the record button, and whatever you want to say, we'll capture it.
Well, Sandra, I'll leave you with this. Mm-hmm. When I was 11, 12, 13 years old, before that, when I was like 10, 12, mm-hmm. I met a wonderful woman in the library, Miss Neela McTaggart Rothshire. Mm-hmm. And she introduced me to a lot of books, especially on the classics. Mm. And then she told me, she said, Sonny, do you know that God gave you a gift of a good memory? You know, you should develop that. I didn't understand it then. Mm. I did not understand it. I went through the world, through life. Mm-hmm. It was only when I was 35 years old that I started to find myself. Mm-hmm. When I got illuminated, I found myself. When I got into University of British Columbia, mm-hmm. And the rest is history. You go there and you ask my professors mm-hmm. and about C. McPhail, and they will tell you. And people were amazed, and I developed my mind. I can remember things when I was 4 and 6 years old. The things that happened, I can give you verbatim mm-hmm. things that happened. Wow. All through the war years, I remember all the things that happened. Mm-hmm. Mm-hmm. And but Cayman people, they used to call me dumb, stupid, old fool boy. Mm-hmm. In that damn old those fool in that library all day sitting on reading them old damn fool books. Look here, how he trying to speak. Come here instead of come here, and so like that. That dumbed me down and had me dumbed down for years and years mm-hmm. and years mm-hmm. and years until I got off here. Sandra, and met good people, and mm-hmm. and Canada who helped me develop my to where mm-hmm. I am today, mm-hmm. and that's why I'm grateful. My son came back with the same thing, and he said, "Oh, Dad, I'm gone. No way they're gonna do what they did to you." My mm-hmm. son is a famous bariatric surgeon out in America, mm-hmm. surgeon in America.
Hmm.
Yeah.
Well, I mean, yeah, you have to stand firm, even in the face of criticism, obviously. I always say that not everybody has to understand or appreciate your journey, but once you know what you're doing, then you just keep doing it. So thank you so much Mr. Steve Macfield. We really appreciate it. And I'm going to keep chasing you up until you say yes to that interview.
Good.
I'm told I'm a very persistent person, which, you know, I probably get it from both sides of the family, but definitely Macfields and even on the Solomon on the other side as well. Persistence could very well be my middle name.
My grandmother, Fanny Solomon, was married to my great grandfather Napoleon Macfield. They came from Bordentown. They were some of the first people that came from Bordentown after emancipation. Napoleon brought his family down here. And then a lot of the brothers went to Nicaragua and to Honduras, and the branch of the Mac and Fanny Solomon, she's family to the Solomons in Bordentown, and like I say, in the Macfields in Bordentown. Now, if you go through history and you go, there's no Macfields anywhere in the Caribbean. We're the only Macfields.
Really?
In the Caribbean islands.
So where did the Macfields originate from?
The Macfields did not come through from Africa through Jamaica and so forth.
Oh.
The Macfields came from Africa to Boston through. The Macfields were owned by Nathaniel Glover. Nathaniel Glover was one of an American slaveholder who was one of the richest men in Bordentown. He was also elected to the Legislative Assembly, to the Vestry in 1831.
Okay.
And when emancipation was over, the Macfields had their freedom, had gotten their freedom. There's only one Macfield was a slave, and he was 12 years old and was owned by a woman. And we came through that way. Now you'll find a lot of Macfields in Nicaragua, in Honduras, and in America. Yeah.
Wow.
But you won't find the Macfield names in Jamaica or in Trinidad or Barbados or any place like that.
Wow. That's so interesting. Wow. There you go. Learning family history as well.
I know where I come from, and I know where I'm going.
Yes. Wow. Truly amazing. Thank you so much for that. That's fascinating. Things that you learn every single day. You just have to be willing to listen. That's what I always say.
And what a lot of people don't know. The Macfield family in Nicaragua are very, very important people. David Macfield was the ambassador to Jamaica. He just retired 2 years ago. David's son Arturo Macfield was the ambassador to the Latin American states, and he defected 2 years ago. He defected last year. It was in October last year. He defected and didn't go back in Nicaragua. He lives in New York now with his family. And Nelson Macfield was the ambassador to Mozambique, and then he was ambassador to Iran. They all fought in the revolution with Ortega. And you go down to Nicaragua, they're very, very important people. And so forth. And so the Solomons in Bordentown. Some of the Solomons were like the Conleys in East End. Half of them stayed white and half of them stayed black. And so the Solomons too. And you do you know Joellen Thompson?
The name sounds familiar.
Bing Thompson's sister.
Okay. Yes.
You need to contact her. She has the largest database of Caymanian genealogy. She have over 100,000 Caymanian people in her database.
Wow. Okay.
And their families, tracing them back from the original settlers, even back further than that.
Okay. Definitely we'll speak with her. Miss Kathy Frazier, I know, and Oliver Watler do quite a bit of genealogy related work as well.
And Joseph Martinez.
Miss Jose. Okay.
Miss Jose. Yeah.
Okay. All right. Well, thank you so much.
We are the people who research the history of our country and our people. Anyway, I gotta go now.
Yes, I appreciate it. Thanks very much.
Okay.
All right, my dear. So, folks,
Okay,
you got
bye.
a real got a real history lesson this morning. I hope that you guys were actually paying attention. Truly amazing. So Jamila says, all people are important, says Stephanie. Jamila says that I'm a McLean, and so I heard about Scotland, and I'll have to do some digging. Good morning, caller.
Hey, Sandra.
Morning.
An excellent show, really excellent show.
Thank you.
And I think you had a question when I spoke to the governor regarding Anna, and they asked, what else can be done? A public inquiry can be done with all the detectives, all of those that were on that field that day. She did not disappear in thin air. We're all adults there.
Did they not do an inquest? This is where I'm a little bit confused. Did they not do an inquest?
No.
How did they do a declaration of death if there was no inquest?
Well, listen to me. This is what they do. The family has a legal guardian, and I can't go into too much because of the details and because the lawyers are involved. But I do know that letters of declaration of administration was passed and so forth. But a public inquiry needs to go through that judicial system, and we need answers. The family has not been spoken to, like how other families that go through traumatic events have been spoken to. It hasn't been. Number two, there's also a reason to stand up and help this family. Like I said, there's more to this story than it is, but I would rather the son come out and talk to you about that with his attorney. I don't want to get into
because one of the things that someone has said to me who's connected to the family, and they've said, I'm just going to share with you what they've said. They feel like you are opening a bunch of wombs for this family, and they wonder whether or not.
They don't know what the son is doing. They don't know what the aunt is going through. They are the ones.
But there's more than one child. Am I correct? Anna had several children.
Yeah, she has. And the one who's speaking up on behalf of them is Christopher, not me. Is Christopher. Not
so
me,
you're saying that
me.
there was never an actual inquest into her death? I mean, I find that very unusual because that's
exactly there's a lot of unusual things with this case. That's why all I've been asking for. Listen, I'm not here to point fingers at this one or that one. I am just here to say, look, these 5 kids are Caymanian children. Okay, we're busy bringing in Tom, Dick, and Harry to become Caymanian. We have 5 Caymanian children that are poor, they're Black. Let's work together and do what we need to do to treat the family right. That is, am I asking too much, or the family asking too much? I don't,
put it this way. Someone said that they're obviously not the only family that have had someone missing, but at the end of the day, I think everybody has to find some degree of closure. And I think there are people who are listening to this who are concerned that if this is brought up, every single day, that maybe the family, including her children and others, don't actually have any degree of closure. And I think closure...
They will never have closure because they've never had their mother to bury and to actually finalize and get that done. But they've never had people...
But you're not going to... I think we've accepted that there'll be no body recovered in this type of a situation. Right?
And that's what I'm saying. And they also they've never had to the point where people have actually said to them, look, they've had dry sorries, but they've actually never had the like what other people would go through. There's an incident, the police are there, they call a meeting in and say, this is what we found. We ask questions, a lot of questions have not been answered to them.
So let me ask you a question. Back in 2020, and that's now some 24 years ago, right? She was missing 9 years at that point, when they actually applied to have her declared legally dead, you're saying that there was no formal process that they would have gone through to do that, because she caught her sister Noreen would have had lawyers involved and all this kind of stuff.
Yes, I got pro bono lawyers for them. Remember that I wrote to the Compass asking if someone would come forward and help the family, because they didn't know exactly all the procedures. Because remember, I got 3 family members that is missing. 3. Not 1, 3, and we have no bodies for them. And the last one, which was my nephew, we declared him dead 2 years later, because that was a massive investigation when the 5 young souls went missing in the North Sound. Okay, so that was why I was able to guide them and help them with it. Yes, people want to see this dead and closed off, but you know what? That's people that don't have a heart, because if it was your daughter, your mother, or your sister, you would want answers and you'd still be fighting. Okay, I know that there's many people here that have wants to fight, but they feel that they can't fight because they feel their hands are tied. But that's not that the other problem I'm calling you for. Yesterday, I mentioned a young man's name which caused harm, and I am not the kind of person that wants to cause harm to anyone. My mother raised me right, and if I did something wrong, I apologize for it. In my failed attempt trying to speak to young people and letting them know that the activities of illegal activities that they may be doing, right, that they should turn their lives around and try to rehabilitate themselves, do something positive, buying land, opening businesses. I gave the gentleman's name on the radio, which was Peter Gooden. And of course, he has a family. So of course, his family felt a way about it. And I spoke to Peter. I apologized to Peter, and I'm apologizing to him again today because I know nothing of Peter drug activities. I was using his name to say that he rehabilitated himself and became a very productive citizen. And I wanted everybody to sort of, take a stand and say, look, we can't go doing bad for the rest of our lives.
To be clear, Peter does not even live in Cayman.
Exactly.
So, I mean, we don't. I mean,
I I don't know anything of Peter's dress. So I don't want no officer showing up to me saying, "Oh, Peter's business." So the words were wrong, were worded completely wrong. But the message I was trying to say or trying to put out was that our young people need to stop killing each other. We're importing people to become Caymanians, and that needs to stop. You all need to take a stand back and do something positive in your life. And I admire Peter for the way that he did change and turn his life around. He bought one of my brother's homes in Prospect, one of my god brothers. And I look at him and I saw him, I said, this guy has really turned his life around. And I'm happy because I worked in the judicial department, and everybody has a past. And saying that, it's just like my cousin Earl, may his soul rest in peace. Earl was into smoking constantly.
I think in the spirit of the apology, you probably should not mention any other names and just leave the apology. Leave the apology right there.
But I'm just saying,
leave it right there.
My cousin Earl, he went down the dark with alcoholism and stuff, and he stopped all of that and turned his life around. No, he's not coming back.
Let's leave it. Let's leave it right there.
Yeah.
All right. Okay. So hopefully Peter heard the apology. Thank you, my dear. Really appreciate it.
No problem, honey. Thank you.
Folks. Okay, good. Okay. This person said, my uncle went missing on a fishing boat 37 years ago. My grandparents moved on and raised their other children. We have no idea what truly happened to him. Unfortunately, this is a story, I suppose, of a lot of Caymanians, maybe not a lot, but we've had a few over the years that unfortunately have gone missing, whether they've gone out to sea. This one was sad because obviously, she went missing at the landfill. But I mean, people are saying she's been missing now for how long? 2011. And so their point is that people do need to let this go. I mean, I'm just telling you what people are saying. So I don't know. And this person said, oh my gosh, that caller again, and big kids that have their own lives now. They haven't had a memorial for their mom since 2020. So why is she bringing it up and they're not even celebrating? And they mentioned that walkers had helped them at the time to get a legal declaration of death. Mr. McFeel has a head on him for his age. Oh, yes, I read that part, I think. Sandy, this is a wonderful show, and I will listen to it again later, as I missed a bit of France, as I had to take my daughter to UCCI and received a call, and I want to hear it. This is what is needed for us to know where we're coming from and to know where we are going. Thank you so much for that. All right, folks, going to go ahead and wrap up the show this morning. Thank you guys so much, as usual, for tuning in. So somebody says, honey child, I think she shouldn't be calling names, and I thought she should never have called Peter's name. Well, I can tell y'all straight up, Peter called me last night and I said, Peter, this is not my issue. I don't know what you're calling me for. I don't even know Peter. In fact, the irony of it, I didn't even know who Peter was until last night. I'm like, who the heck is Peter Gooden? And then when he mentioned it, I got to be honest with you. When she mentioned his name, I didn't hear the name because some of y'all be going on for a minute when you call in and I do start to tune stuff out. So I didn't hear his name. So when he's like, oh, somebody called my name. I'm like, somebody called the name on the show this morning. And when he kept going on and on and on, I was like, oh, okay. I don't recall hearing who the name was, but I do recall the other comments that followed. So, you know, yeah. He feels aggrieved about it. Even if you have a history, I suppose, you know, you want people to move on at some point. So I don't know. Gabby says their names are Jamie, Randall, Michelle, Astor, and Josh, who's family friend. And we also have no justice. It's going to be 15 years soon since they have been gone. This is the ones who went on the boat with the kids. Yeah, there've been a number of cases. And listen, I know that, oh yes, Gabby says my family was the first 5 family members to go missing at sea. And we still have no bodies of any of them. And it's going to be 15 years since they've been gone and we never got any closure or justice. Well, this is unfortunately the situation when people are lost in situations like this. The reality is your closure may be that you never get closure. Like you never get to know all of the details of what happened. So all the increase in the world 24, 30 years later, I hate to tell you, the truth of the matter is all they can say is death by misadventure. And you know what that means? That means that they just don't know. they can't really, you know, they just don't know. So I'm sorry to say that, you know, you may just not know. I mean, I don't know what else to tell you except, oh, sorry. I had my years mixed up. 2020. I was thinking 2000 when I saw that. 2020, which is 4 years ago. So, you know, it's a very real possibility that Anna's children and her family, what they know now is all they will ever know. That the last place she was seen at that landfill, they're pretty confident, unfortunately, that she did not come out of the landfill. And that is the most that you can know. And sometimes these types of wounds, if you keep reopening them, doesn't really give you any closure. Like what answers would they like to have that they believe can give any additional closure? I'm not really sure. You just will never know. It is what it is. So let me see. Somebody says Miss Aldine Evans' father and brother went missing. Nothing happened. Anna's family to this day, my uncle has never been declared legally dead. Gabby's family is not the only family members that have gone missing at sea. Definitely not the first. I think she was saying the first group of 5, which I mean, I don't know that we've had that many before. But yes, that was a significant number. And that one, I think, if it's the same one that I'm thinking about, actually involved several children as well. That's why I'm not really a fan of allowing children to go out on boats between Cayman and Honduras or Cayman and Jamaica. Those trips are a little bit too perilous as far as I'm concerned. And you just have to, you know, be very, very cautious. But the sad reality is, it's not that we're trying to be insensitive to the family in any way, shape, or form. But unfortunately, yeah, there were 2 kids on the boat with the 5 lost at sea. That's right. There's the other guy. That was the one with, what was his name now? I can't remember his name. Edison, is that his name? He was also in that boat, I believe. There's been a few, so I might be confusing some of them. But I think the bottom line, unfortunately, is you have to accept, Edison Haylock, right? I think you have to accept that people get lost at sea. And oftentimes you're lucky, you're very, very lucky if you find any remains, any remnants. I recall some years ago that there was an incident where people drowned out past the reef and they only found a leg to let you know he ain't coming back. They only found a leg of one of those individuals. And so does that give you any closure? I mean, I don't really know. I think it's fair to say that everyone has probably accepted that the person is deceased. And I mean, I get that not having answers always leaves you uneasy, but it you know, you're not going to have anything concrete. And I'm not sure. And again, I'm going to reach out to the police because they would have had to have been some sort of inquest into this that would have gone through the court system. So I do find that hard to believe. You know, yeah. Mm-hmm. All right, that hasn't happened. All right, folks. Thank you so much. Debbie says Natalie Holloway disappeared in Aruba many years ago and still no closure for her mom. Well, actually, they just had closure the other day because didn't Vander, whatever the heck his name is, finally told them what he did to Natalie? They always suspected what had happened. And now, as of last year, they have officially declared that the 18-year-old American high school graduate was actually killed by him. And so he admitted to this in October of last year. So they do have some kind of closure. At least he's admitted to it, and he kind of told them some of the details. But that was 2 decades later, you know, when she vanished in Aruba. So, yeah. So he eventually confessed to it. Dude is a serial killer. He's got some real issues. And that was his first victim. And he thought, I guess, he was going to get away with it. But listen, nothing stays in the dark forever. If things are ever to come to light, you better believe that they will. All right. So, Gabby, this one happened 15 years ago. It's probably been about that time. One of the guys had a very young son, right? Because I remember he lived up the street from me with his mom. He was a little toddler at the time, maybe 1.5, 2 years old. Because I remember him walking up to Coco one day and kind of grabbing Coco. And I remember that was where they lived. So I'm sorry for all of your losses. I think that it's a sad reality that there are a lot of people out there that have had this type of tragic loss where someone has, you know, disappeared and they don't have all the answers. A young girl, but I'm thinking of a different one. There's another one with multiple people and children on a boat that also went missing, and the little boy lived with his mom down in Newlands. But unfortunately, Gabby, I mean, I hate to say it, but again, it's not entirely unheard of that people go missing, especially when it comes to journeys out at sea and that sort of thing. Very, very sad. So our condolences to everyone who has lost loved ones tragically. And we hope that you can find some degree of peace and hopefully by extension, some degree of closure. So thank you all so much for tuning into the program today. Big shout out to our Instagram listeners. A lot of them hang on through the entire program. Good morning. Oh, Peter. That's Peter over there on Instagram. Oh, you have Instagram, Peter? It says good and Peter. Okay. So good morning. Thanks again to the governor's office. We've been trying to arrange that for a minute. She was able to finally come on. And thank you to the deputy governor. He wasn't like a planned guest because somebody said, oh, he could only give us half an hour. He actually wasn't a planned guest. He just agreed to answer the call to answer the one question about the visa, ends up staying on for half an hour. So we appreciate it. You know, I know these guys are busy, but listen, they've got to make time for the people. I mean, you know, whether they're civil servants or whatever. So they've got to make time for the people to speak directly of you. I want y'all to make note of the fact that your MPs are not making time for you, which not for nothing, but I know Mr. Panton, I can't call him. People say I keep inadvertently calling him Premier. My apologies for that. He's no longer the Premier. And it really is a Freudian slip. I'm not doing it on purpose, I swear. But he is trying to come on tomorrow, but I know he's been sick. He's had this cold cough thing that has lingered forever. And I know he was at the doctor's again this week. So I'm hoping that he's well enough to potentially come on the show either tomorrow or Thursday, depending on how again, he's feeling, because it's really hard to talk. I've had it. You guys know I had it in December and January. And it actually really is hard to talk when you have that, because it brings up all the phlegm and you can't breathe and talk properly. So hopefully he'll be able to join us this week. I'll keep you guys updated. All the other MPs, we waiting on y'all, honey child. We waiting on y'all. I'm just saying, the people are asking the question. I saw your questions. Where are representatives? So we shall see. Tomorrow's show, tomorrow's Wednesday. I want us to talk a little bit about the recent changes with NAU and how exactly that is going to work. Sounds a little bit like we're becoming a social state, like we want to pay for everything for everyone, and we can't afford it is the problem. We cannot afford it. And, we are unfortunately raising people who are becoming lazy and entitled, and, they just want everything handed to them in a silver platter. That can't be the case. Dee Dee, thank you so much. Dominique says we need to live thankful and doing peaceful and loving deeds. Good morning to Miss Carla. She says, thank you. Gabby, I'll check out the link that you shared in the comment section, and really appreciate it. So big breaking news here. You guys heard it first this morning. Civil servants getting enhanced paternity and maternity benefits. Hopefully this will eventually have a trickle-down effect to the rest of people in the Cayman Islands. We're going to keep harping on these things, folks, because these are very, very important discussions and resolutions for people that we need to be having. All right, y'all be good. We'll catch you tomorrow.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.